So welcome to How to Crush the USMLE 2026 Masterclass. This is the data-driven blueprint from our most recent 4,700 plus recent test takers. As you would know, my name is Dr. Manik Madaan. I'm currently a resident physician here in the United States in the field of psychiatry. I'm about to graduate to become an attending. And I'm grateful to be one of the most leading authorities in the field of USMLE space and teaching the students on how to match into their dream specialty. I am the co-founder of USMLE Wise, which is the leading company that helps students go from step one all the way till the match into their dream specialty. And we generally provide USMLE coaching, like help with getting US clinical rotations, interview prep, and help with research. And just to give you a bit of a context into who I am, I personally have given the USMLE like you guys, and I have a 260 on the USMLE Step 1 at the time when it was scored. And I personally scored a 271 on the USMLE Step 2. This was in 2022. I'm also the creator of Step Genie, which is the world's first USMLE AI Qbank. As you would know, we are growing rapidly, and students love this Qbank to study for their Step 1 and Step 2. Apart from that, what's the scale of impact that I've been lucky enough to have? Personally, via group coaching, have mentored about 19,000 plus students for Step 1, Step 2, Step 3, and also the match. If you consider them, also the creator of USMLE Exponential Advantage, which is a test taking system that helps students crush the USMLE via using elimination or ruling out, which is instead of knowing A is the answer, you rule out B, C, D in order to come to A. That's what Exponential Advantage teaches. That itself has about 43,000 plus students. And I've coached about 1,820 students to a 270 plus on Step 2. And this is via group coaching and using my courses. And our current pass rate for Step 1 is 99.3%. This has decreased a bit from last year, and this is probably because of multiple factors, maybe because we're scaling so fast and maybe because we're expanding and that kind of dilutes the cohort. But that's a pretty good pass rate if you look at what's happening with Step 1. Just to show you, again, I have done well on these exams. So that gives me some credibility to talk about these things. And if you ever were to reach out to me, these are the social media platforms I'm the most active on YouTube, Facebook, Instagram, and LinkedIn. And again, this is Exponential Advantage, which is my test taking course, I've been lucky enough to impact more than 43,000 plus students via this. And this is just, if you ever want some free value, you can go to my USMLE Step, my USMLE YouTube channel, where I post a lot about on how to prepare for Step 1 and Step 2. Again, I'm also the creator of high intensity learning, which is a system that accelerates learning by 100x in a way such that you never forget. You read faster, and I've been able to impact about 2,300 plus students. And this is a free course for anyone who wants to learn how to learn. And here are just a few testimonials that make me put a big smile on my face, where students have learned from me and gone ahead to crush Step 1, Step 2, and Step 3. And this just is one of the main reasons I do this is because of the impact that I've been able to make. And this is just one of my students who was able to even surpass me, and she reached out. She ended up getting a 280 plus on her Step 2. Currently, she is a resident here in the US in internal medicine. But I am just so blown away that my students are even crossing me and surpassing me. I'm so grateful for that. Why do I do this work? We'll be covering Step 1 this time, but I do need to let you know why I do this. My real mission is to show every student, every human out there, that they're not average, that there's never a time that you're not enough. I want to show you how extraordinary you actually are, to give you systems so powerful that nobody can put you down. Because again, you're not average. I see this so many times where students will reach out, Manik, I've always been an average student. Can I do this? Can I do X, Y, Z? Can I score a 260 on this? Can I get into dermatology? And I just feel so bad because when they put that average label on themselves, they have locked themselves out of all opportunities, because your mind is the biggest prison. Your limiting beliefs is the biggest prison. And you have rejected yourself before the specialty like dermatology or any competitive specialty can reject you. So my main mission with what I do is to teach you how to be limitless. And with USMLE Wise, what we are trying to do is we are really trying to arm the next generation of doctors with the best medical knowledge, which is via USMLE coaching, our super skills of research, and exponential technologies like artificial intelligence. So they go and tackle the biggest problems in medicine and create a world free of illness. And that's what we do at USMLE Wise. And our vision is a world where you as a doctor feel invincible because you're armed with the latest, most up-to-date information, and you're trained to keep up with the pace of how fast medical knowledge is growing. That's why. That's our why. That's the big reason that I'm here, that USMLE Wise is here. So what are we going to discuss in the masterclass beyond like the mission is that by the end of the masterclass, I want to show you why the 2026 step one is fundamentally different and how do you dominate it? What's the right blueprint? Then I'm going to give you frameworks. I primarily have three frameworks. The first framework is a framework for elimination, which is the ability to, instead of just know inherently what's the answer A, you're able to, let's say, if I don't know the answer, I've read the question stem, I'm able to go ahead and rule out multiple answer choices in order to come to A. This is a fundamentally different skill set than medical knowledge. And once you are armed with this skill set, you're never afraid of going to your USMLE steps and being like, what if I don't know this answer? What if I don't know how to answer this question? Because you're able to, you know, in your mind that even if I don't know what the answer is, I'll be able to look at clues that the question writer is giving me in order to cut out different answer choices, rule out different answer choices, and come to the answer. So it's such a empowering tool, and it eases anxiety. I felt excited a lot of the times before my steps because I knew I was able to go in. I was at least, I would pass, if not score like 260, 270, whatnot, using these frameworks. So there was no reality in my mind that I would fail because of this. So that's the framework number one that I want to give you. The framework number two that I want to give you is what I call as hyper reading, which is doubling your reading speed. I think this is so important because if you're able to double your reading speed, you do the exam in half the time, and the rest of the time that you have freed up, that can be substituted for increasing thinking time. So you get more questions correct. Instead of taking, let's say, 90 seconds to read a question, which is the average time that most students take, if you can do it in, let's say, 45 seconds, the rest of the time can be freed up for increasing thinking, for increasing rationalization. So you're able to like double your score. I think double is too much of an exaggeration, but at least increase your score by 25% to 30%. So this is a super powerful technique. The third framework that I want to give you, apart from this, is what I call as encoding variability. We'll talk about what this is, but this is a way of learning USMLE content such that you don't have to revise. Revision becomes a thing of the past versus encoding variability, which is, I'll teach you what this is, but you're using multiple resources to augment what you already know and revise what you already know in many ways. You're not going back to the same resource. And because of that, you don't have to keep revising. I think I use the word revision, but you're reviewing the same knowledge using different resources, which increases encoding, which is your ability to learn and not forget. So just for my visual folks out there who want more of a visual representation of what we'll be going through, first of all, I'll be covering the 2026 pattern shift. Second, I'll be showing you the three core systems that I talked about. The first one being the ability to come to the answer without knowing the answer, which is called as elimination. The second is doubling your reading speed, so you can increase thinking time and solve questions better and be able to come to the answer in a question where you're confused about. The third system I'm going to give you is how to, like the complete blueprint, how to study for step one, the current 2026 step one, without forgetting information. So you're going to get that. And lastly, for anyone who stays till the end, we'll give a free match predictor. And this is just for people who stay at the end, which is worth $200. And this can give you the exact chances of you matching based upon all your credentials. And in the end, we'll also do a Q&A. So you save your questions for the end. I'll be addressing each and every one of them personally. So I just want to start with the current trends of what's going on with step one. And this is from a recent study, which evaluated the trends of step one passing, the amount of students passing step one across 2019 to 2024. So from 2019 to 2024, what was happening with the step one pass rate? So as this is what you're seeing right now is the MD and the DO pass rate. We'll go into the IMG pass rate as well. And you can see that in 2019, the MD and the DO pass rate was about 96%. However, if you look at 2024, what does that drop down to? 89% for MDs, 86% for DOs. So if you look at this aggregate data, we have dropped about from 97%. If you look at, I think it's 96%. I think I'm calculating the 97% from the 2020. That's why it says this in the past 4 years. But in the past 4 years, we have dropped from 97% to 89% on the USMLE Step 1 for MDs and DOs. And this is because the exam that students are preparing for is not the exam that you're going to take. And the same thing applies to international medical graduates. This is from the same study where they evaluated USMDs, COs, and IMGs. And you can see that at some point of time in 2019, the IMG pass rate was close to 84%, as you would see, maybe less in 2019. 84% in 2020 is like where the data, I think, I've taken these numbers from. And you can see that it has dropped to 72% as of 2023. And our own internal audit, because we have so much of data collection because of the amount of following that I have, we have personally found this to have dropped down this year to 66%. We have the biggest IMG pooled data set. I couldn't do it for MDs and DOs, but based upon those reports, the current pass rates are about 66%. And again, this is because students are doing multiple things wrong. I'll go into what those multiple things are, but this is what the recent test taking, anybody who's taking the test recently is reporting to us. Number one, they're reporting dramatic pattern shifts. You will see now HPI style questions come up on your step 1 and step 2, where they'll give you a patient chart, which didn't used to be a thing. This is a completely new thing. You'll see very long questions, like page-long questions, multiple of these across your blocks. This is just something happening recently that we have found and many students have confirmed. This has created unpredictable time pressure, destroying even people who are supposed to pass. You will see reports of these people failing. There's also more ethics and QI questions being asked. The reason for this, the more of the reason for this is because everyone has medical knowledge, but it is the ethics and the QI question, the ability to improve a system, improve your current body of literature, a current system, which is your residency. That's a higher level of thinking, and that is what the USMLE wants to test. So that's something we are seeing as well. We're also seeing about 40% more micro and antibiotic questions than expected. And also memorization has been on a decline. Anything that requires memorization has been on a decline. And what has become more of a priority for the USMLE Step 1 test is the pathophysiology. We also find a resource misalignment that's been going on with students who are using like the traditional resources, like just a BNB bootcamp, where they don't cover a lot of what is coming up in the recent Step 1. One of the main ones being the nutrition update that you would have seen recently, where they're increasing 6 more categories that will be tested across your Step 1, Step 2, and Step 3. And this is one of the main reasons you will see students failing and even score low on Step 2 is because they're using outdated strategies, which is outdated material for an exam that is already evolved and is evolving ever faster. Second is weak memory methods. Most students that I meet, they're using very basic light active recall, maybe it would be Anki, and passive recall, which is reading first aid or just doing a couple of series, instead of doing the heavy weightlifting, which is essentially multiple Qbanks, not just one Qbank, but multiple Qbanks, which leads to better retention. So they're just doing very weak memorization, which ends up leading to a fail or even a low score. And third is no test taking frameworks. Since at least Step 1 went pass-fail, many students have ignored the ability, the skill set to be able to come to the answer without knowing the answer, because they're like, oh, this is just a pass exam, which is really shown up in the data, as you would see. So we are going to fix all of these 3 things. So by the end, you will be a USMLE assassin. That's the goal. Instead of a prisoner, I want to make you an assassin of the USMLE. Okay. But first, like before we start, what I want you to do is I need you to make me a promise before I'm going to give you so much value. It is going to be crazy. I want you to make me a promise is that you're going to close all distractions. If there's any Instagram open, TikTok open, WhatsApp tabs open, I want them all gone. And secondly, I want you to commit to being all in, not just watching, but absorbing. If you're tenant, go ahead and start taking notes, because a lot of you will forget much of what I've taught across this masterclass. So I want you to go ahead and make notes. So it's more of an active thing rather than a passive learning that you're doing. And I want you to take notes if possible. If you have a pen and a paper, go ahead and take notes. And again, stay till the end, because I'm going to deliver crazy amounts of value. So I want you to put in the chat, I'm all in, and we'll go ahead and I just want to make sure people are awake. Awesome. I'm all in. I'm seeing a lot of I'm all in. Awesome. I love the enthusiasm. Awesome. Okay. All right. So I just want to give you a brief insight into, you would see these numbers, me performing so well, you'll be like, oh, Manik, you're different. Whatever you teach might not work for me. This is maybe a bit too complex, whatever you're going to teach. I don't know if this would be okay with an average person like me. That's the common limiting belief that I hear from a lot of people. So I just want to tell you, though, whatever I'm going to teach you, again, I'm going to get into it. But I personally was never the topper in my medical school. I actually failed on my first anatomy test, which we call it as a supply in India, and that held me back. However, and at that time, one of the biggest breaking points, I've always been called an average person. I wasn't able to get into the best medical school, no matter how much I tried, no much hard work I put in. I never was able to be a topper in my med school or in my class, like in high school, whatever. And I think the biggest breaking point for me was, I remember this time in college where I was like trying really hard to pass through my exams. And I remember I liked this girl, and she told me, she looked at me like I'd failed my exam, and she told me, Manik, you're a hard worker, but you're also average. So you need to keep working hard so that you can make past whatever the supply that I had, the anatomy thing that I had. And I think that really destroyed me, because I was like, why God, why me? Why can't I look at these toppers? They look at things once, they never forget. They have such good retention. They read so fast. They score so well. Things are just so easy. They go to the exam with a smile on their face. Why am I so worried all the time? And I think that was really one of the biggest breaking points in my whole life. And what changed my life was that I ended up reading self-help books. One of the best books that I read was this book on how to improve your memory and how to improve your cognition, which was the book by Jim Quick. This guy, if you don't know him, I just want to give you a brief introduction to who this is. So Jim Quick he's a teacher of learning, meta learning, how to learn super fast without forgetting. And many of the systems I'm going to teach you actually come from him. And he's worked with Elon Musk. If you know him, he's worked with the cast of Wolverine, Iron Man, all Marvel movies, to teach them the same methods to remember scripts and never forget. So he's written this book that I really like. It's called Limitless. And this book actually changed my life because it taught me how to remember information without forgetting. And basically, this guy, his story is that he had a TBI, traumatic brain injury, which left him helpless. Like, he couldn't remember a thing. All of his memory, short-term recall was gone. He was struggling through life, and he had to go through hundreds of books and a lot of memory rehab, if you know what TBI rehab is. So he learned a lot of techniques from their systems in order to improve his memory. And he's gone ahead and created systems on it. Like, it's called the Limitless system, which is taught to so many people. And it has really helped me and multiple other people that you've met. Like Elon Musk, if you know about him, has learned from him. And apart from that, the cast of Wolverine, if you look at, I think it's Marvel, you can see he's worked with the cast of Marvel, X-Men cast, and he's done great work. So I'm going to give you many of the same systems, the best of the best, that have helped me crush step 1, step 2, and like everything at life that you would see. And these systems, again, the amount of success it has created for me. People used to say that when you do UWorld for the first time or for your USMLE Step 1, it's impossible to go into the 90th percentile or get 93% questions correct. Yet if you look at my first pass using the same systems, the first time I did UWorld, I got 93% of the questions correct, and I scored in the 90th percentile. And this is just my NBME progression at the time, the NBMEs that I did. My starting NBME score was 261 for step 1. And as you would see, my scores were pretty high, right, as I was going through the NBMEs, despite me being somebody that other people called average. That all because of what I had learned, which were these systems, to how to learn, how to rationalize, how to think. We call it luminal thinking. And because of that, you would also see that this is a consistent finding in my performance. The same systems that you have seen, like that work for an average person like me, would work for anyone. If you're above, like probably you're above average, such that you're here. So they're definitely going to work for you. If you look at my step 2 first pass for UWorld, you would see 85% correct, right, on my first pass of UWorld using these same systems. And this is just, again, my step 2 first pass. You would see I've scored in the 94th percentile. This is not my second pass, which is very different. And this is just my UWSA scores. The same systems applied for step 1, as you would see. This is for step 2, by the way. You would see a 293 that I got on my UWSA 1 and 276 on UWSA 2. So all in all, what I want to tell you is that when you're going to go write your USMLE step 1, what is going to kill your pass or your score on step 2 is not that you're not smart enough. It's not that you're not going to study enough hours. You're studying probably the same that everyone else is studying. It's not that you've not done enough UWorld passes, which a lot of others, if you go to Reddit, everyone's, hey, do another UWorld pass or do this, that. It's none of these that's going to dictate success on the exams. What will dictate the success on the exam is not doing any of these things that I'm going to teach you. So what will kill your score is using a 2022 strategy, which is outdated materials for a new USMLE Step 1 exam, thinking knowing more is scoring higher, which is absolutely not true. You're just going to fill your brain full of fluff, which will kill your score and your pass, because you're going to go to your USMLE Step 1, know a lot of things that don't matter, which will come in the way of you solving questions which require a lot of precision, right, in order to solve, and a lot of time pressure. So you need to wither away resources that don't really matter to create space for knowledge that is high yield in order for you to easily pass on Step 1 and score high on Step 2. Apart from that, having no elimination systems, which is the ability to come to the answer without knowing the answer. And lastly, just making the time pressure work. If you can't make it work, that's going to kill your score, and encoding information passively. Just to recap all of this, again, a lot of students, I need to summarize it for them, is there are two types of people that I see who go and write the USMLE and go ahead with the match. Is there are two types of people. The first one is the USMLE prisoner, who's being just pegged with nonsense that you just need to know a lot to score high. These people don't have testing skills. They know a lot but can't apply it under pressure because they have a lot of knowledge, but a lot of that doesn't translate to the new test. They're pretty slow readers. They're taking a lot of time to read per question instead of thinking per question, and they're guessing a lot. If you're guessing a lot, that generally falls in the category of USMLE prisoners. On the other hand, the common themes that you would see with what I call as USMLE assassins, which is they're assassinating the questions rather than the questions assassinating them or hunting them, is they possess testing skills, which is they're able to come to the answer without knowing the answer. I'll show you this in action. Secondly, they can read fast to expand thinking time. So instead of taking 90 seconds, they're taking 45 seconds and then allocating the rest of the time to think more and perform better in their exam. And lastly, they are preparing for an exam that already exists using high yield information. So they end up passing and getting a 260 plus. So let's first start teaching you the powers of testing skills, which is the ability to come to the answer without knowing the answer. So here are the 7 powers of testing skills that you're going to learn in just the next 25 minutes, which will increase your score, as you would see, at least by 20 points to 25 points. It's crazy. Number 1, testing skills, which is if I know A, right, I can get some questions correct. But if I don't know what the right answer is in many of the questions I'm going to see, let's say the question answer choices are A, B, C, D, E. If I don't know what's the answer, testing skills empower you to rule out answer choices to come to the answer, which is A, right? So they help you come to the answer without knowing it. Because of this, they increase your performance on every single question of the test. If you have more medical knowledge, what that leads to is you getting 1 or 2 more questions correct based upon that medical knowledge. But if you look at testing skills, you can apply the same skill set to every single question on the test, which leads to an exponential improvement versus a linear improvement that you would just see with the knowledge. Because of testing skills, you get more consistency across all exams. You get less score variability across your NBMEs on your test because you are able to come to the answer without knowing it. And this is why you would see as my scores, as I was showing you, I was consistently able to perform at a very high level. And you would not see any drops in my performance, as you would see. It never dropped. My score never dropped because of these testing skills, because the same skill can be applied to every single question. Next is they significantly boost question learning. When you learn how to rule out option choices, you learn in a way that helps you do it even better the next time, and then even better the next time. So it becomes a reinforcing loop, which is very strong. And this is why you would see that performance that I had is that reinforcement loop of solving a question using the test taker's mindset. And then because of that, I learn in a way that most people who are just running on knowledge cannot do. And they end the plateau stage, you would see my scores improving, and I'm not plateauing ever because of these. And they end this struggle of powerlessness, where if I go on the exam, I don't know the answer, I'm worried. You will no longer feel that while having testing skills. And they end the unpredictable nature of the test because you'll be able to come to the answer for a lot of questions just based on ruling out answer choices. So the new paradigm that I want you to take for the 2026 exam is, instead of just studying, memorizing, recalling under pressure, hope you remember, and then taking a lot of time on each question, solving them, and then running out of time, I want you to learn testing skills, which is pattern recognition. I'll teach you what this is, extracting the signal from the question, strategic elimination, and then ruling out answer choices in order to come to the answer, which is likely A, rather than just looking at A, right? That's a very different learning mindset. That's a very different application skill set that you will have. So I'll show you this in just the next 25 to 30 minutes. So we'll dive firstly into test taking skills. I'll give you that. I generally charge like $99 for this if you were to take my course, which is Exponential Advantage. So you will get all of that for free in the next 30 minutes. That's my system one. In system two, I will teach you how to cut your reading time in half. So you expand your thinking time. And in system three, I'll give you the complete blueprint to crush it on step one, the current 2026 step one. Now what we are going to do is we are going to use test taking. I'm going to show you how to come to the answer without knowing the answer. And the basic premise I want to take from this when I'm introducing test taking is the way USMLE questions are designed is number one, the question writers are going to give you two kinds of information on a question as we'll go through. Is they'll give you a 15% signal in the question, which means 15% of the information to sometimes 25% of the information is relevant to the question. The rest all is noise. It is a distract. The ability to segregate signal to noise is what I call as signal to noise ratio. If you're really good at picking out the signals versus the noise, the higher somebody's ability to do that, the higher their score generally is, because they're able to take out the crap in the question and just focus on what's pertinent, which of course would give you at least 15 to 20 points across the whole exam, as you would see. So the ability to look at the signal, rule out the noise, will help you eliminate strategically. And I will show you this in action. We'll do this. I would like a volunteer. If you can raise your hands, we'll go through the question. And I will show you the difference between somebody, and I want somebody who's starting with USMLE prep. They started with step one prep. So I'll look at who here is a volunteer, okay? And we'll get you here. Awesome. So I see a lot of raised hands. Wow, this is hard. I think I will take Neha Kamath. Neha, if you can just unmute yourself. Let me just see if are you able to unmute yourself, Neha, or no? Yeah, so let contributors, so let me just, yeah, now you should be able to, can you unmute yourself? Yeah.
Am I audible?
Yeah. Are you able to turn on your video?
Not at the moment, if that's okay.
That's okay. I just like when there are faces and it's visual and it's not like I'm on a monologue. So that's why I ask. Can I get somebody who'll be on video? I need somebody on video because I think it just makes it a better experience for everyone. Let me try. I think we can try Disha.
Do you want me to turn on the video as well?
Yes. It's just, I think it's a much better experience for everyone. And it doesn't look like a monologue.
Okay.
And lastly,
I have
are you
turned it
starting?
on.
Hi, are you starting with your USMLE Step 1 prep? Where are you in your USMLE Step 1 prep?
I have started like a month ago.
Okay, you're a month ago. So I think you're the perfect specimen to demonstrate this on. So you're going to learn how to rule out answer choices, and which will allow you to come to the answer, right, on every single question, hopefully. If not that, at least rule out 50% of the answer choices. So you're doing pretty well. So are you able to see the screen? Yeah, 1 second. So let me just make sure I'm getting your name correct. It's Disha.
Yeah.
Awesome. Nice to meet you, Disha. Where are you speaking from?
I'm speaking from Georgia, but I am
Awesome.
from India.
Okay, you're from India. I have a lot of students who masters here from Georgia. So I think you guys are incredibly hardworking. That's what I will tell you. Anybody who goes to Georgia, so
Yeah,
hardworking.
university has already prepared us for that. Yeah.
Yeah,
We
very
are
hardworking people. I work with some students from there, and I can consistently see one theme is hard work.
yeah.
Yeah, Tisha, what I want you to do is if you can read this for me, right, as we go through this, I want you to read this question and tell me what do you think is the answer.
Okay. Should I
And
read it out loud?
Yeah, you can read it out loud. Yeah.
Okay. Okay. 75-year-old woman is brought to the emergency department after losing consciousness at her home. She has a history of getting up from her bed and falling and losing consciousness for several seconds. She has a history of AFib, hypertension, and angina. She is currently taking aspirin, chlorthalidone, warfarin, nitroglycerin as needed. She is afebrile, pulse is 110 per minute and regular. Blood pressure is 98 by 52 mmHg. She has a dry tongue on physical examination. Her capillary refilling time is 4 seconds. Cardiopulmonary examination is normal. Further evaluation of this patient will most likely show. Okay.
So you gotta choose. 90 seconds are about to over. Give me one answer.
Okay. I think it should be increased troponin maybe.
Okay, Disha here chose increased troponin. Guys, what do you think could be the answer? Let's just look at the chat. So I see a lot of E's, popliteal vein. I see C's. I see D's. Wow, wow. I love the enthusiasm. C, E, D, E. So we are all over the place. So Disha, we're going to cover this again. Like, wow. Okay, guys, we can stop now. Yeah, I think I saw there's a lot of B, C, D, E's, and I see a lot of those. So I'm seeing the B, I'm seeing C, I'm seeing D, I'm seeing E as mainly the answer choices. What I'm going to do is, so Disha, you chose, let me just make sure I am, okay. So what we're gonna do, guys, is how do we like certainly arrive to this answer without knowing the answer? How do we rule out answer choices here? So we're able to comfortably come to the answer and then apply the same concept to every single question. So that's what I'm gonna teach you with Disha. So you're the test subjects. So Disha, what we need to do right now is like I'll teach you a system and we're going to enact that system. So the first thing I want you to do, the next time we're gonna read it again, is I want you to start with the question key, because this is the key, by the way. Further evaluation of this patient will most likely show what's going to happen. That's the key. The reason we want to start with the end line, the last line, the key is because of this. The common example I give people is there are two ways to go to the grocery store if you want to buy, let's say, something. One way is that you already have a list. All right. You already have a, okay. There's two ways to go to the grocery store. One where you already have a list of what you want to buy, and then you go to the grocery store. The other way is to go to the grocery store and then figure out what you want to buy.
Yeah.
Which one do you think is faster? Is it going to the
When we have
grocery
a
store
list.
and when you have a list? Why?
Because we already know what we want to get.
You already know what you want to get. So most students read questions the other way. You don't know what you want to get. You're starting with the first line. You don't actually know what you want to get. This is actually the list. This is the main point of the question they are asking at the end. The last line is the main thing. That's your list. This is very similar to looking at, let me ask you, what color car do your parents have, Disha?
Gray.
Great. Do you find that because they have a gray car, like maybe once you got a gray car, you started seeing more gray cars?
Yeah.
When you get a red iPhone or a black iPhone, you start seeing everyone who has the same iPhone. Or if you get a phone, you start seeing everyone who has the same thing. It's not that thing expanded. It's just the way your brain works. It has a limited attention span. We call it the reticular activating system. If the reticular activating system is not trained on what it wants, it's going to go and scramble. Instead of being laser focused on what it wants, which is when you prime it with what the question is, when you prime it with a grocery list, it's going to be like this, which is going to waste a lot of your time. So the first part about getting questions more correct, reading faster, is actually knowing what you want, knowing that you want the milk. And because you know what you want the milk, what's going to happen is, because I know what's the intent of the question, what's going to happen is, because I've gone through this and I read the answer, the question itself, I'm going to start filtering, right? Based upon, okay, I want the milk. I'm only going to look for facts where the milk is mentioned or the grocery list items are mentioned. Because I want certain grocery items, I'm going to the store, which is the question itself, the question stem, and I'll be able to figure out, okay, I need this, rather than when I start here, with the question, the grocery store, what's going to happen is I'm going to be scrambled in my head. Then I come to the realization after I've been through the whole grocery store, okay, oh my God, I just wanted the milk. And then I'm going to go back to the grocery store. I'm going to take another straw and try to figure it out. So that wastes a lot of time. What I want you to do is the next time you read a question, I want you to start with the key, right, of the question, which is what is the primary intent? After you read the key, what I want you to do, this is the last line, is I want you to go through the answer choices. Because when you go through the answer choices, it primes your brain. Okay, this is, you're building your grocery list as you went through the last line of the question stem. Then you went through the answer choices. You're priming your brain. Look at what matters. What are they asking for? And then you go to the question stem. I call it the reverse sake. So you go through the key, you go through the answer choices, and then you go through the question stem and you come back. It's called the reverse sake technique. Because of this, your brain's primed on the gray car, your brain's primed on the grocery list, and it knows what it's looking for. And you don't need to go ahead and reread the question, which may waste a lot of time. What I see with a lot of students is they'll go through the question stem, then they'll look at the key, then the answer choices, and now they've already forgotten what was in the question stem. So they'll go through the question stem again, and then the answer choices, which wastes a lot of time. So the first fix we're going to implement is you're going to go through the key first. That's the first part. Then you're going to look at the answer choices. And third, you're going to go through the question stem. That's what you're going to do. Number one. Number two, that what we'll do after you do this, is we are going to start spotting clues to what the answer could be. There are two types of clues that you would see, and I'll introduce what those are. There are positive clues and negative clues, but the prime thing we're trying to do here is this. We don't know what the answer here is. So the only way we can come to the answer is using elimination, eliminating answer choices based upon clues that they've already given us and patterns that we've already seen. Things like history, age, sex, ethnicity, things like physical examination finding, things like laboratory findings can give us clues into what could be the answer, what could not be the answer. The question, think of a question as like an escape room. If you guys have been to an escape room or like a detective game, the question writers know you don't know the answer everywhere. So they're going to give you certain clues, which will tell you a certain answer is the answer, and certain clues called negative clues, which will tell you certain answer is not the answer. I know it sounds a lot of complex stuff. I'll explain this, and you don't need to worry about this. In order to master elimination, you need to master two skills. The first one is pattern recognition, which is understanding that the USMLE will test you on the most common presentation of a disease. What does that look like? If it's a DVT, if you look at distal vein thrombosis, generally USMLE will give you a 35-year-old female who is either a smoker or using OCPs because they can increase hypercoagulability, or she's pregnant. That can also increase hypercoagulability. And she will present with swelling of one leg. That's how DVT presents. And of course, hypercoagulability, as you would see. That's just generally the presentation of DVT. They would not give you a 70-year-old man who has never smoked, never used OCP. Why would he use OCPs? But he's never smoked and doesn't have a swelling of one leg. That is an atypical presentation of DVT. So they will never give you that pattern because the point of the test is to train you on the most common patterns. That is called as pattern recognition, which is I should know the common presentations USMLE will ask me for a certain condition. And when I know that, that can help me rule out, okay, this doesn't look like that common pattern. Number one. Number two is sarcoidosis. So if you look at sarcoidosis, generally the common presentation that you will see in life that USMLE will test you is a female who is African American in her ethnicity. Let me make sure one second. Yeah, guys, if you can comment a bit less, because that's okay. Yeah, for sarcoidosis, they're going to give you a woman who's African American in ethnicity, and she is 20 to 40 years old, and she presents with bilateral hilar lymphadenopathy. They will never give you a Caucasian female who's, let's say, 10 years old, and she's presenting with bilateral lymphadenopathy, hilar lymphadenopathy, and that would qualify for sarcoidosis because that's not the point of the test. The point of the test is to train you on the most common presentations. So if you have that knowledge that USMLE is going to test me on the most common presentation, then using that knowledge, I can guess that, okay, if the presentation doesn't match the most common presentation, I can rule out that answer choice. And that's so powerful. So that is skill set number one, is pattern recognition. So remember the DVT thing. I want you to keep this in mind, and we'll go back. But remember the DVT, the way USMLE will test the most common presentation is 35-year or older female. She's smoking or she is using OCPs or pregnant. and she's presenting with swelling of one leg. We'll use this in our question solving tutorial that we just did. Second thing that you need to know is, yes, increased. What I mean is increased hypercoagulability. It shows, it's just like a way of indicating, but it means there will be hypercoagulability. I think that's somebody in the chat asked, so just answering that. That's the first skill set you need to learn, okay, is pattern recognition that we're going to use with Disha. She's going to use that. Second is clue recognition. What is clue recognition? The USMLE, just like an escape room or like a detective game, it will give you two types of clues. One are positive clues, which will point you towards a diagnosis like DVT or pulmonary embolism or pericarditis. So there will be certain clues. Example of certain clues are, let's say if I'm looking at myocardial infarction as the answer choice, what are the clues that they will give me? Chest pain, nausea, pain that is radiating to the jaw and the left arm, sweating, poor exercise history, obesity. These are positive clues in the whole question stem that point towards the diagnosis of MI. But what are negative clues? Negative clues are clues that they will give you that tell you that a certain answer is not the answer. An example is, in the case of MI, they might tell you that the pain is dull, which is not typically the presentation of MI. It's not a dull pain, it's a crushing pain that you would see with MI, crushing chest pain. They might give you, let's say, apart from this, they might tell you the pain is radiating to the back. That again is a negative clue towards the answer being MI. Again, they might, for example, we are looking at DVT.
Oh my God.
And we're looking at DVT. And when we look at DVT, the negative clues, they might, the other negative clue that they might give you, what I mentioned was negative clues by commission. They'll explicitly tell you that the patient, let's not talk about the DVT right now, but for MI, they might tell you that the patient has a dull pain or that they have pain that's radiating to the back, which is an overt negative clue, which tells you it's not MI, right? Or they might tell you something else, that the patient is not complaining of nausea. That is, again, MI. Everyone who generally has MI, a lot of them have nausea. So that is an overt negative clue. It's by commission, they will tell you. The other negative clues that you need to look out for is what we call as negative clue by omission, which means it's not mentioned, so it must be assumed. That's a certain reality is the reality. An example I can give you for a negative clue by omission is that they give you a presentation of somebody with myocardial infarction. They're having a chest, this person is having a heart attack, but what's missing in the question stem is there is no mention of chest pain. There is no mention of nausea. The fact that they have not included a clue is itself a clue towards a certain answer not being the answer. I will do this with you, but what you need to be looking out for is, number one, is pattern recognition. As we go through the question stem, what are the most common presentations of a certain disease, and does this match it? Second thing I would want you to look out for is clues. What are the positive clues for every single answer choice, and what are the negative clues for every single answer choice? And then we are going to build a signal to noise ratio, which is positive clues by negative clues. And what ends up happening is any answer choice with the highest signal to noise ratio, which is the answer choice with the highest positive clues to the negative clues, the least negative clues, and the highest positive clues, is the answer choice, which is generally going to be the answer. So we're going to apply it, right? And I'm going to do it with you. And this is going to be the most incredible thing you learn for USMLE Step 1. That's what my students keep telling me is, I cannot believe that I never learned this. And because this is so powerful, it's going to help you with Step 2 and Step 3, whatever you can think of. This is the most powerful framework. Okay, can you come back and let's read through the answer, the question stem, and try to solve it again. And I'll help you with the thinking process as well. Remember how we decided to read the question? We're going to start with the key, then we're going to read through the answer choices, and then we are going to go to the question stem. Okay, so let's do that. Okay, let's start again.
Yeah, I should start with reading the question again.
You should start. We can do that later. I think you can just start with reading the question just the way you do. I think I can show you how to cut down time later as well. You can start with the question stem itself. One second, let me make sure everyone else is muted. Yeah, Disha, are you here?
Yeah, I'm here.
Yeah, go ahead and read the question for us.
I think I cannot see the screen.
Now you should be able to see it.
No, it's still not visible.
Should be visible now.
Yeah, no, it's visible.
Awesome. Let me make sure the screen is pinned for everyone. Yeah, it's pinned. Yeah, let's go ahead and read it again.
Yeah, so a 75-year-old woman is brought to the emergency department after losing consciousness at her home. She has a history of getting up from her bed and falling and losing consciousness for several seconds. She has a history of AFib, hypertension, and angina. She is currently taking aspirin, chlorthalidone, warfarin, nitroglycerin as needed. She
Mhm,
is afebrile, pulse is 110 per minute, and regular blood pressure is 98 by 52 mmHg. She has a dry tongue on physical examination. Her capillary refilling time is 4 seconds. Cardiopulmonary examination is normal. Further
mhm.
evaluation of this patient will most likely show. Yeah, so I have to first read the question, the bottom line that I have read. So, looking
Mhm.
over the options, I think it should be either like increased troponin cannot be there because there are no signs of MI over here.
So
So,
you're using the testing framework. I think you chose A first. Yeah.
yeah, I
So
chose A
so this is the power of elimination, guys. Once you have, it's like an instant click, and if you can just,
first.
this is so fast. So A
Yeah,
was not the answer, but fine,
yeah.
A is not the answer.
E cannot
What
be
could be?
there and F cannot be there because friction rub is, I think, associated with pericarditis. So it cannot be there. So it can be
What could
either
be?
B or C. Yeah.
Okay. So
Yeah.
you are stuck between B and C. There could be another answer. Let me ask you, this patient also has hypertension. Can
Okay.
hypertension not cause LVH?
Yeah, it can.
B, C, and D. We are stuck. Now let me teach you how to think through this, which is we're
Mhm.
going to look at the positive clues and the negative clues. And we're going to look
Mhm.
at all the clues together. First of all, if you go through, what I want you to do is in your mind, I want you to take out all the clues, okay, whatever they have given me, and add that as an equation. I really like to think of these as an equation. So I just take out all the fluff, all the connecting words is and whatever, take that out and just put out the facts on the right side. So that's what I put out. Now we're going to build the signal to noise ratio for each single answer choice. So for increased troponin, what are the positive clues
Uh,
that we are seeing that in this question stem? If you look at the question stem, what are the positive clues for increased troponin that you see here?
Losing consciousness, maybe.
So syncope can happen in MI. Yeah,
Yeah.
if you
Yeah.
have sudden cardiac death can also happen. Syncope can
Mhm.
happen. Can you
Yeah.
also see that she has like hypertension, so that also increases her risk for an MI? She's
Mhm.
also taking drugs, aspirin, and she's taking nitroglycerin. So probably she has history
Mhm.
of, again, she has history of angina. She has history of angina pectoris. So history of angina.
Mhm.
And if you have
Yeah.
MI, that can cause tachycardia. So it can increase heart rate. That's a positive clue. It can cause hypertension. And it can also cause cardiovascular collapse, which can cause systemic hypertension, which will cause like dry tongue, right? And can also increase capillary refill time because of heart failure, correct?
Yeah.
What are the negative clues here that are telling me this is not MI?
Maybe, wait. AFib. She has a history of AFib. So no pain,
So
like the pain is not there, so that can be
no
there.
chest pain, no chest
Yeah,
pain.
yeah,
So this
yeah.
is a negative clue by omission. What that means is they have omitted out the clue, which should
Mm-hmm.
give you the assumption, okay, it's likely not the answer. Also, if this was MI, you would see nausea. I don't like, it doesn't happen in everyone, but generally the presentation is nausea, they're sweating, and we are not seeing any of that. But a strong clue is like some people will be like angina pectoris. What I want you to differentiate is that there's another classification you should know for clues is there are soft clues and there are hard facts or hard clues. History of angina pectoris does not mean that every patient currently is you're seeing has an MI. If I'm going to a clinic and they're presenting with the same presentation, syncope, doesn't mean it's a MI. So that's a soft clue. It's just history. It's not a fact. On the other hand, there are hard clues, which are like hard facts. And this is like the EKG is showing you ST elevation. which is a hard fact you cannot ignore. This is objective reality. So that takes priority. If I were to see ST elevation versus history of angina pectoris, ST elevation is a stronger clue. It's a harder clue in the overall scenario. Even if I look at symptoms, you might have somebody with chest pain, but if you find that the EKG is negative, sometimes you can have MIs with negative EKGs. But if you find the EKG is negative and then they do, let's say, whatever PCI, and they find no blockage, that is the no blockage as you do stenting or whatever you're doing, your angioplasty or whatever you're doing there. If you don't see it in the scope, but the whole presentation tells you it's MI, then it's likely not MI. So you need to weigh objective clues, which is your lab test and physical examination, over any history, over any like presentation as well. I would rank it as objective clues are more important than presentation, the current presentation. That's more important than history. So the fact that a lot of you will be like, this patient has angina pectoris, so this should be increased troponin, which is seen in Emma. The point is, history of angina pectoris doesn't mean she's having like any angina pectoris right now. So the fact that she doesn't have chest pain, that's a certain negative clue that I have. So all of this is a probability. So right now, the probability is there is a negative clue. So I'm not really sure if A is the answer. It might be, but based upon what I'm getting, likely not the answer. Maybe it is, but I'll keep that in my mind. So there are a lot of positive clues, but a negative clue of no chest pain. Now let's look at absent P waves on ECG. Where do you see absent P waves on ECG? That's one place where you're confused. Riksha, where do you see absent P waves on ECG?
I think it's AFib.
Yeah, AFib. Tell me what are the positive clues? So negative clue here was no chest pain. The rest is positive clues. If it was absent P waves on ECG, what are the positive clues that tell you that this is AFib?
Losing consciousness.
Syncope can happen, correct, in AFib.
Yeah.
What else?
Yeah, and she has a history of AFib.
History of AFib.
Yeah, and hypertension is there.
Okay, hypertension is there. Okay, that can sometimes cause dilation. Anything else? You can have hypotension.
Yeah.
If you have AFib, right? You can have cardiovascular collapse, which can cause increased capillary refill time.
Yeah.
Correct?
Yeah.
What are the negative clues here that tell you it's not AFib? Guys, you can also help her in the chat. What are the negative clues first tell me by commission, which is they explicitly mention it, and then by omission that tell you that maybe it's not AFib.
Like ECG, nothing is there on ECG. Like they haven't given anything about ECG. Pulse is regular.
Pulse is regular. So many of you must have missed, even though she has a history of AFib, and as you're seeing, she's on warfarin, whatever, many of you missed is, the other thing is tachycardia. I think that's what you forget, that's positive clue. But what you missed was, look at her pulse. It's regular. So that's a negative clue, regular pulse, correct? What else tells me this is not AFib? Cardiopulmonary examination is normal. Generally, if you do cardiopulmonary examination, that also requires auscultation. It's not just pulse. It also requires auscultation. There's nothing noticed there. It's sitting out there. So guess what? Maybe B is not the answer because we've gotten so many negative clues. So the positive clue to negative clue ratio here is low. This is the signal to noise ratio. So we're drawing signal to noise ratio for each. It's low. Here it's also low. Let's look at C, elevated BUN. Where do you see elevated BUN, Diksha?
Like any renal disorders. Okay,
renal disorders.
Yeah. And I'm not sure of the cardiopulmonary. What happens in that? Yeah.
Okay. So let's say I'm not sure. Like maybe it's C. This is the point, like even Diksha. So let me ask you, if in this case, what are the positive clues that tell you it's elevated BUN? Or what are the negative clues?
I think hypertension.
Okay. Hypertension is likely a positive clue. Anything else?
Yeah. And
so what I'm getting is Diksha maybe doesn't know enough about this topic. She doesn't know that, and that's okay. What we'll do is we're going to suspend C because we're not sure. We're going to use test taking. This is like, again, the power of testing. We're going to go to D, which is left ventricular hypertrophy. So tell me, what are the positive clues that tell you it's LVH, what are the negative clues?
Positive clues can be the person having hypertension or angina, or maybe the person is losing consciousness.
Yeah,
Taking
hypertension, syncope,
and
right?
drug history, medication
Okay,
history can be there.
yeah, maybe. But what about medication history?
Like the person is he's taking chlorthalidone, warfarin, nitroglycerin. So yeah, maybe
So how is that
nitroglycerin
a
can be there.
positive clue? How is nitroglycerin a positive clue
I just thought
towards
that
LVH?
maybe yeah, yeah.
It doesn't have to mean much. Like you can be on
Mhm.
nitroglycerin or not, doesn't have to mean much. So hypertension
Yeah.
plus syncope, there must be some left ventricular failure or whatever can happen, eccentric hypertrophy, as you guys would know. So this is what I've gotten. My other question is, what are the negative clues that tell you maybe it's not LVH?
Because it's not having any ECG like abnormalities, so that can be there. And
Yeah, sometimes they might not mention ECG. So that's something, again, all of this is a probabilistic estimate. What else here overtly tells you it is not
normal
LVH?
cardiopulmonary examination.
There is no S4.
Yeah.
No, cardiopulmonary examination is normal. They've told that to you. They've given it out to you. So guess what? The positive clue by negative clue ratio here drops. So likely D is not the answer, A is not the answer, B is not the answer. C, I'm not sure because I don't know enough about the topic. So we're going to go to E, popliteal vein clot. What do they mean by popliteal vein clot? What would you say that is, Diksha?
Maybe it's clotting, like DVT is there, so it can like yeah.
It's DVT. And let me ask you, what are
Yeah.
the positive clues here that tell you it's DVT? What are the negative clues?
H
Okay, age
and
75-year-old female. She's a female.
hypertension.
She has
Hypertension.
hypertension.
Yeah.
Doesn't have to be like you don't have to have hypertension to have DVT. I'm not going to include that, but this is why common presentations are important. The 75 female, right? Can you also see that she has AFib, which can increase her chances of being hypercoagulable?
Yeah.
Maybe, and she's taking
Yeah.
warfarin though, which should help. What and if you have like a DVT, right? You can have pulmonary embolism. Can that cause
Pulmonary
syncope?
embolism. Yeah.
That can cause syncope. That can cause cardiovascular collapse, as you were seeing, capillary refill time because the blood's not flowing. So you can see
Yeah.
dry tongue and capillary refill time increases. So those are positive clues in like pulmonary embolism due to DVT. And she has hypotension, which can happen with saddle pulmonary embolism. She also has tachycardia, which can happen with saddle pulmonary embolism. So this could be the answer. What here tells me that this might not be the answer?
Because the patient is wait. I'm not getting any negative clues. Actually, maybe the patient is taking.
Here's DVT.
Yeah.
What do you not see?
Hypercoagulability.
Okay. What else
There's
do you
also
not
a
see?
history of smoking or
Swelling.
contraceptive use.
Okay. But again, these are softer clues. What's the hard clue?
Yeah.
Is there any swelling of one
Swelling.
leg?
Swelling.
The age
Yeah,
of the
you should
patient.
have swelling. Yeah,
Yeah.
swelling. The age is not. You can
Yeah.
be 35 and above and be hypercoagulable. The
Yeah.
fact that she's female,
Travel
right? Probably
history.
she's out of. Yeah, guys, like only Diksha is allowed to speak. Please put it in the chat. I'm reviewing the chat. It just confuses everyone. So I appreciate your enthusiasm. If you can just keep it in the chat, that'd be great. So let's just help Diksha solve it. Diksha, you don't see any swelling of leg.
No.
So is that not a good negative clue?
Yeah.
The rest all does make sense. So I'm looking at how much of the presentation can be explained in positive clues by a certain answer choice versus, and those are the positive clues that you're trying to amass. Second thing, what I'm trying to do is I'm looking at the negative clues and using the negative clues, I'm trying to see maybe what's the, like positive clues are my hypothesis and negative clues are my null hypothesis. If you were to think about it in terms of research, I'm thinking in a probabilistic estimate. What is the alternate hypothesis, which is the positive clues? What is the null hypothesis, which is the negative clues? So you see no swelling of one leg. So maybe this is not the answer because there's no swelling. There should be a swelling if you have DVT, correct?
Yeah.
Generally
Yeah.
don't get a DVT without a swelling. Now let's look
Yeah.
at friction rub. Where do you see a friction rub?
Pericarditis.
Okay, so in pericarditis, what are the positive clues that might tell you it's pericarditis versus negative clues?
Consciousness, loss of consciousness.
So if you have severe
And
pericarditis, it can cause syncope. Yeah. and it can cause you to
Yeah.
lose consciousness. If you have cardiac failure because of pericarditis, that can cause hypotension, tachycardia, dry tongue, capillary refill time can be increased. What here is a negative clue that tells you it's not pericarditis?
No chest pain.
No
Nothing
chest
is
pain,
mentioned. Yeah.
right?
And
What else tells you
yeah,
it's not
cardiopulmonary
pericarditis?
examination is normal. That is the
So
biggest negative clue.
yeah, because you should get a friction rub when you do a
Yeah.
like a cardiopulmonary examination. So right now,
Yeah.
Diksha, that we have taken you through this framework, what do you
Yeah.
think would be the answer?
I think it should be C.
Correct. That's the right answer.
Yeah.
Even though you don't
Yeah.
know much about it. And this is the
Yeah.
exact superpower of test taking that people keep ignoring. Is a lot of the
Mhm.
times when you look at my scores, I was scoring like 93% on my first class of UWorld. People are like, how is that possible? The way it's possible
Mhm.
is number one, you need to think through the question in terms of probabilities, the answer choices, where you're
Yeah.
building the signal to noise ratio for each. And let me ask you, Diksha, do you think after learning this, that you'll go back
Yeah.
to maybe first aid, or you'll go back to solving questions very differently and learning
Yeah.
differently? Would you say
Yeah.
that's
Yeah.
true?
Of course. Yeah.
And could this compound over time as you're learning? The test taking is
Yeah.
interacting with medical knowledge extraction. You're understanding, okay, you're labeling things, okay, this is a hard evidence. There are MIs where you don't have chest pain as well. If you have diabetes, that's different. But you're looking at hard evidence, which is EKG, versus soft evidence, which is could be presentation, could be apart from that history. You're comparing those. So the once you learn test taking, your whole knowledge gathering, the way you learn from first aid, from any other resource changes completely. And this is why you see those consistently high scores, and why I've been able to get
Yeah.
my students the kind of results. Is just one of the big skill sets is test taking. If you can master, this is like absolute gold. The answer is
Mhm.
elevated BUN. For those of you who don't conceptually know, this can happen in hypovolemia. If you look at
Yeah.
this patient, what are the positive clues towards hypovolemia? So this patient is taking chlorothalidone, which is what, a diuretic.
Yeah. Yeah.
And
Hypovolemia,
yes,
hypokalemia, they all can cause.
yeah. So hypovolemia, what does that cause? It causes pre-renal failure, which is causes the BUN to go up. When does
Yeah.
your urea go up? The time when your urea goes up is not generally when you have kidney failure. It is pre-renal failure. What that means is like post-renal doesn't always cause it. Anything that's renal doesn't cause it. It's pre-renal because when you have low volume, you have low blood in your body or low fluid in your body, needs to absorb more fluid. And guess what gets absorbed with fluid? Urea. That's
Yeah.
the osmotic force. So that's why urea rises whenever you have hypovolemia, which causes pre-renal failure, which causes the BUN to go up. And guess what? This
Yeah.
patient's on diuretics, as you can see here. She is hypotensive. She has orthostatic hypotension because of that. Plus, she has tachycardia. Capillary refill time is higher. Dry tongue on physical examination. Cardiopulmonary examination. It all makes sense. When you look at negative clues, there are no negative clues towards this that I can find.
Yeah.
So the signal to noise ratio for this wins, and that's why this is the answer. But even if you don't know the answer, the power of test taking is if I can only rule out, let's say, 3 of these. Now, instead of having, if I look at the chance, if I don't know test taking, I'm guessing on 1/6, which is I have a 16% chance of getting it right. If I can only rule out 3, now it goes to 50% when I'm guessing. Would you
Yeah.
not say that's powerful, Diksha?
Yeah. Sure.
Yeah, that's test taking. So guys, that's the first skill set that you need to take with yourself is test taking. Once you know this, it's magic. The second skill set, and this, if you just implement this, you're going to get 20 to 30 points easily. The next skill set that I'm going to teach you is called as hyper reading, which is the ability to cut down your reading time in half. So you're solving questions faster and you have more time to think rather than just read the questions. Thinking is what matters, not just reading. So I'm going to teach you the next skill set, guys, which is hyper reading that we're going to go through. So for this, I would need another volunteer. Thank you so much for your time, Diksha. So if you can raise your hands up, I'm going to just choose one of you and we will do that. Okay. So I think Krishna was very excited. So I'll just take Krishna. So Krishna, you can come and join. You can unmute yourself and I don't think Krishna is available. I don't know where he went. I think I'll choose maybe Raghav. I'll choose Raghav. Raghav, can you unmute yourself? Let me just review the chat to make sure I am seeing everyone and I'm reading. Okay. I think Akshat can join. Akshat, if you want to join, I see that. So you can join. Let me just check what are the settings. Let me just make sure. Okay, I'll unmute.
Oh, yes, sir.
Yeah, Akshat, can you turn on your camera if that's okay? Yeah,
Yes,
awesome, awesome. Where are you speaking from?
I'm currently.
Where are you speaking from? Can you unmute yourself? I think you let me unmute you. Can you unmute yourself?
Yes,
Yeah.
sir. Yes, sir.
Yeah. So
I'm
where are you
currently
speaking
in
from?
India.
Awesome. And what phase of USMLE Step 1 prep are you in?
I have just started the preparation, like 15 to 20 days.
Awesome, awesome. Have you solved any questions yet?
No, no. Only I have
Okay.
started with the first aid in the BNB.
Okay. Did you find what we just did useful?
Yeah. It helped a lot.
Awesome. Yeah, that's a framework number one. What I'm going to give you is even more, and this is going to go
Mhm.
crazy. So what I'm going to teach you is what we call as hyper reading, which is doubling your reading
Mhm.
speed. So you have more time to think through the question. Do you think that would be helpful if you could just double your reading speed and then double your time to think?
Yeah, that's what I
Yeah.
was asking in the chat, like how to read the question fast and how to do all this stuff in 60 to 90 seconds.
Yeah, I do most of this in 45 seconds. And one of the reasons
Mhm.
you'll see such high scores is every question is done in 45 seconds. And once I do it in 45 seconds, the next thing I'm doing is implementing signal to noise ratios. And I'm like, okay, what is the alternate hypothesis for each of these answer choices? And then based upon that, I'm able to come to the answer and rule out. And that's why you see such scores. So the current problem I see with most people, again, the category I call as USMLE prisoners, is that they are taking too much time to read a question, sometimes even 90 seconds plus. And by the time they're done with the question, they're just choosing based upon whatever comes in their gut rather than rationalizing it, which lowers their exact score that you would see. The estimation that we have done is that you lose 15 to 20 points if you're not reading at the speed that I'm telling you that you can achieve, which is half the reading speed, which is within 45 to 50 seconds. If you're able to do that, you gain 15 to 20 points. If not, you lose those 15 to 20 points. What are you going to do in hyper reading? You will be able to do it right after this webinar. Is you're going to double your reading speed from 200 to 250 words to 400 to 500 words, which is double. You're going to take about 45 to 60 seconds per question. And because of that, let's say even the highest estimate, like the 60-second, if you take even 60 seconds rather than 90 seconds per question. So generally, if you look at the USMLE, a lot of people might not be aware, is 90 seconds is the max you can take for a question, because the whole exam, like the way you divide the questions and all, if you do 90 seconds per question, your exam will be done in exactly the 7 hours that they will give you. It all adds up. So you need to take less time than 90 seconds to double your thinking time, so you can again rationalize rather than just choose on some gut instinct that comes by, okay, this like we did before. Not like that, like the gut instinct. You need to use signal to noise ratio. You need to create time in order to rationalize, to rule out things, to come to the answer. So if you use this, you're going to do the entire exam in 4.7 hours rather than 7 hours, which will give you 2.3 hours throughout your exam just to rationalize, just to rule out stuff. And this is why, again, such great results with certain people who are able to implement this versus not. So the two core techniques I'm going to teach you here that I'm going to go with Akshat and you're going to learn with him is number one technique is called as pacing. What is pacing? So basically, when you read something like, let's say the two core techniques that you're reading here, when you go from left to, your eyes move in saccades. If you know what a saccade is, when I move my eye from left to, let's say it's a complete macro movement. I'm taking my eye from the complete left to the complete. It is not a smooth movement when you do it. Just try to do it. You're trying to move your eyes without moving your face from left to right. You will see that it's not a smooth movement because of saccades. Whenever you move your eye complete, let's say from left to right direction, it has these micro movements called saccades, where you have this movement and then you go back via nystagmus. Then you come back, then you go back via nystagmus. Then you read a bit, and then you go back via nystagmus. And so it is just these interrupted movements which slow down reading. So what a lot of people who are in this domain of speed reading have discovered is, in order to avoid saccades, in order to kill these saccades and just go left to right smoothly, you need to use a pacer, which can be either your Apple Pencil if you're reading something. It can be your pointer, which is your mouse pointer. It can be your finger, but on the exam, it's going to be your mouse pointer. So what we're going to do is we're going to use your finger cursor to guide your eyes as we move through the text from left to, you can try it right now as we're reading, let's say this question. Try to read left to right without a cursor versus, let's say I use my Apple Pencil and now follow cursor itself, the line. You will see your reading smoothens up and it fastens up. So that's point number one, is you're going to use a pacer. I know it sounds stupid, but it is crazy effective. The amount of difference it makes is crazy. And you might be like, Manik, okay, I'll save maybe 3 to 4 seconds per question. You save more, but think about it in the context of the entire question pool, which is 280 questions. It's a lot of seconds. Even if you can save 3 to 4 seconds per question, right? Into 240, that's about how much? 960 seconds. And 960 seconds is about, right, if you like divide by 60, my maths is 16 minutes. Based on whatever mental maths I can do. So you've saved 16 minutes, which will give you extra points. But from my estimates, this is going to add at least 10 seconds per question if you're able to do this. Number one, pacing. Number two, the technique that you're going to implement is what we call as indentation. And I will teach you how to do this as well. Let's first start with pacing and let's time him. I'll start a timer as well to see how fast he reads using a pacer. Sorry, without a pacer. We'll first do this, then we'll use a pacer, and then we'll use indentation. Okay, are you ready?
Yes, sir.
Okay.
Oh shit.
Okay, awesome. So what we're gonna do here is, did it make sense what I just said using a pacer?
Sir, will you share the recordings?
One second. Yeah, I would request everyone to mute themselves, except Akshat. Akshat, yeah. So what I want you to do right now is just read this question stem for me, and we'll time you. Okay.
Okay, sure.
So let me just start a timer. Let me start a timer. Let me go to my clock here, and we'll start a stopwatch. I'll give you some grace time because again I'll be moving screens, but we'll start a stopwatch and see how long it takes. Okay. Reading the question, and that's it.
Okay.
Okay. Yeah. Let's go and read the question. Can you read this for me?
Yeah. A 65-year-old man with non-ischemic cardiomyopathy treated with a furosemide, carvedilol, lisinopril, and digoxin comes to the emergency department with palpitations. His last left ventricular ejection fraction was 35%. His BP is 160 over 100, and the pulse is 130 per minute, and it's irregular. Lungs are clear to auscultation, and abdomen is soft and non-distended. And his ECG shows atrial fibrillation with a rapid ventricular response and non-specific T waves changes. Therapy with rivaroxaban and amiodarone is initiated with the improvement in the symptoms. The patient is discharged home after 2 days with these new medications added to his initial regime. 2 weeks later, he returns to the emergency department with a profound anorexia, nausea, and generalized weakness. Which of the following is most likely cause of the patient's symptoms? And the options are drug interaction, erosive gastritis, GI bleeding, and mesenteric ischemia, occult carcinoma, and F is the pancreatitis.
Okay, so we timed him. So it took about 90 seconds. I'll give him grace of 2 to 3 seconds, whatever. It took about 90 seconds for him to read, and this is most people. What we are going to do now is, if we are going to implement pacing, which is I'll use my Apple Pencil. You can use your mouse. So Akshat, you just follow the Apple Pencil as I go the lines that I'll draw and read with it. And we're going to time you again. So I'm going to just go back, and I'm going to start with the help of the Apple Pencil. So I'm just making sure it's working. And in reality, you would use your mouse as the pacer, but I'll use the Apple Pencil given the constraints I have. So let's do that. Okay, are you ready?
Yes.
All right, so let's go. So let's start. Let's go.
A 65-year-old man with non-ischemic cardiomyopathy treated with furosemide, carvedilol, lisinopril, and digoxin comes to the emergency department with palpitations. His last LV ejection fraction was 35%, BP was 160 over 100, and pulse is 130 per minute and irregular. Lungs are clear to auscultation. Abdomen is soft and non-distended. ECG shows AFib with a rapid ventricular response and the non-specific T changes. Therapy with rivaroxaban and amiodarone is initiated with the improvement in the symptoms, and the patient is discharged home after 2 days with these new medications added to his initial regime. 2 weeks later, he returned to the emergency department with a profound anorexia, nausea, and generalized weakness. Which of the following is the most likely cause of the patient's symptoms? Drug interaction, erosive gastritis, GI bleeding, mesenteric ischemia, occult carcinoma, or pancreatitis.
As you saw, he saved about 18 seconds. This is just using pacing. I'm going to make it even better, and it's going to get crazy. Did you find that you read faster a bit, like with the help of pacer?
Yes,
Right.
sir.
So that's going, you need to use your cursor. I know this sounds stupid, but it saves you so much time. When 1 second looks like one question looks like 18 seconds. But when you look at 240, 280 questions on step 1, 320 on step 2, it's a huge difference. It makes a huge impact from what I've seen. The second technique I'm going to teach you, and this is not all, right, is what we call as indentation. What is indentation? If you look at this question stem as we are seeing, what he did was he was reading, Akshat was reading from A, like the extreme left, to the extreme right. What this does is that as he's reading, he is not using his peripheral vision because he's only using his central vision, which means his point of vision is going from A all the way to D, and then from emergency all the way to F, which is wasting his peripheral vision, which he could have utilized. So how do we use peripheral vision to speed up reading? The way we can do this is by drawing lines. We call this indentation in speed reading. So you draw these lines here, and your vision needs to go with man. If I look at man, Akshat, if you look at man and you don't look anywhere else, can you just your peripheral vision just see 65 on the left side?
No, I'll only concentrate on that particular word.
No, but I'm just saying you're concentrating. But can you like guess? Okay, it's 65. I can see using your peripheral vision. If I look at digoxin, if I just look at digoxin, can you at least see the comes as well without looking at the comes while looking at digoxin? The same applies if I look at department, right here, just looking at the department. Can your peripheral, without looking at the emergency, can you say that you're just looking at the department, your peripheral vision can see the emergency as well?
Yes.
Does that same apply here? If I just look at the pressure, can your peripheral vision also just see the 160 by 110, or 160 by
Yes.
160 by 100?
Yes.
So instead of what we're going to do now is, right, we're going to use a pacer, and then we're going to put down imaginary lines to use our peripheral vision. The reason we are doing this is because when we go from the extreme left using our central vision to extreme right, it wastes a lot of time here and here, which we don't want to do. What we want to do instead is we want to draw these spacing lines that you're seeing here. I'll just draw these spacing lines for you, and I think I'll make it easier on you. I generally use pacers still here. The better you get this is, the more closer the lines get. But what you're going to do is this. I'm going to draw these two lines here just to make it easier. And what you're going to do is, instead of reading from the extreme left to the extreme right, you're going to start reading from old, and your brain will already see the 65. You can say that, and that's okay. But you're not going to look at any of the thing here in this left bar as we are seeing here. All you're going to do is you're going to look at here, and you're going to go all the way to this. So we're cutting off 1 by 6 on the left and the right, and we're going from within this field. We're going to only read within this whole field, and we are going to go from left to right, while our peripheral vision is making up what is ever on the left side and the right side. We're not. Does this make sense?
Yes. Yes.
Okay. So what I want you to do is, as we read the question, I don't want you to look at the A, the emergency, the at G, none of this. What I want you to do is just look at whatever is inside the lines, not outside the lines, and your peripheral vision, using your peripheral vision, just speak it. A 60, let's say I'm looking at old right now. So I'm going to say a 65-year-old man, and then I'm looking at digoxin comes to the, I don't need to look at using my central vision at the come and the word. So we're going to do it, and we're going to time you again. Okay. And I'm going to make it very easy on you because I think you're new to this. So we're going to draw the lines pretty, this. And even for like these, you don't need to use your full vision. You can just, okay. So let's go ahead. Are you ready?
Yes.
Okay. So let's get started. Okay, let's start.
So it's a 65-year-old man with a non-ischemic cardiomyopathy treated with furosemide, carvedilol, lisinopril, and digoxin. And it comes to the emergency department with palpitations. His last left ventricular ejection fraction was 35%, and his BP was 160 over 100, and the pulse is around 130 per minute and irregular. Lungs are clear to the auscultation. The abdomen is soft and non-distended. ECG shows AFib with a rapid ventricular response and non-specific T wave changes. Therapy with the ribaroxaban, amiodarone, is initiated with the improvement in the symptoms. The patient is discharged home after 2 days with these new medications added to his initial regime. 2 weeks later, he returns to the emergency department with a profound anorexia, nausea, and generalized weakness. So, which of the following is the most likely cause of the patient's symptoms? First is the drug interaction, erosive gastritis, GI bleeding, mesenteric ischemia, occult carcinoma, and pancreatitis.
As you would see, we saved even more time. I think I'll give him 5 seconds grace, and he's still so new to it. So you could have been close to 60 seconds if you just do this well. So you were able to cut down your reading time, right, from 130 to about 105. And this is just doing it for the first time. If done well, what ends up happening is you'll be able to cover most questions in like 45 to 50 to 60 seconds max. And once you cover that, what I want you to do is another mistake that I see students make is for the sake of this whole thing, I started with the start till the end. But the way you should read a question is always go at the stem. Which of the following is the patient's symptoms? So, go to the key of the stem. This is called the key. You need to start with the key of the question stem. That's the first thing you read in any question. Then you go to the answer choices just to get your grocery list, get your brain primed to what could be the answer. And then I go to the grocery store and using the pacing and indentation, I go through the whole question stem. When you use all of these in concord, number 1, pacing, number 2, indentation, number 3, you're reading the key of the question and then the answer choices. So first this, second is answer choices, and third, you're going to the question stem and you're going back. That all will save you about a lot of time. Trust me, it will cut down the timing to 60 seconds for most people. If you do it well, even 45 seconds for most people. The reason we want to do verse 8, like I was showing you, is start with the key, which is the last line of the question stem, then the answer choices, and then the question stem, is because I find that if you don't do that, if you start from the extreme start to the extreme end, people end up going back to the question stem to reread it because they've already forgotten it, right? Versus if you start with the key of the question, the last line, and then go through the answer choices and then the question stem, you don't need to repeat it over again because your brain already knows, okay, this is what I was looking for. Versus the other way around, when you don't look at the last line of the question stem, you don't do that. You just start from the start. You need to repeat it again because your brain is, okay, I came here for what? Grocery store? Okay, shit, I need to go back. So when you combine all of these three together across every single question, so what I've given you is meta skills, which means that all of these apply to every single question, which is going to lead to an exponential gain in scores, not just linear gains. So that is hyper reading. What I want you to do is, as you go back, I want you to take 2 things with you. Number 1, I want you to, for your first week, I want you to start master pacing, which means just use your cursor, whatever, to read through the question stem and never do it without it. Number 1. After week 1, what you can do, once you're comfortable with using your pacer, week 2, I want you to practice indentation, where you're drawing out imaginary lines and you're not reading from the extreme left and the extreme right. You're reading within the field that I've given you. If it's hard, you can just expand it, right, until it's comfortable, and then try to compress it as much as possible, and you will get faster and faster as you're able to compress. So that's the week 2 I want you to do. And just by doing this, you're going to get 4.7 hours, which is about 140 minutes extra per exam, which will save you a lot of your points. This is just an example I gave you from one of the students who worked with me. This was a DO student. And this student was taking about 90 to 100 seconds, as we saw before, like other students, per question. And they were scoring in the 240s at the time step 1 was scored. So they came to me and we worked on this, and I taught them the exact technique. And they ended up taking, instead of 90 to 100 seconds per question, only 50 to 60 seconds per question, with 40 plus minutes to spare left. And because of that, their final score was 254. They just increased their score out of all things just by increasing their reading speed, because this is so powerful if you do it well. So I've given you two systems right now, which is number one, you've gotten the system of elimination, you've gotten the system of the ability to read faster, which will give you not just more time, more thinking time, and bigger scores, which is huge. So now that should decrease some of your panic in your exam. Next is, how do you study for the new USMLE Step 1 syllabus? That's something that people ask me all the time. I'll be just covering this in 5 minutes because I think it's not that hard. And then we can go to the Q&A. So the main premise of your preparation should be Qbanks oriented. Why should it be Qbanks oriented? The reason it should be Qbank oriented is because what you saw before. A USMLE question is not going to give you just plain facts and tell you the answer like other exams will. It will make you think. It will ask you to form your hypothesis, alternate hypothesis, and then null hypothesis, which requires a lot of your ability to contrast one condition from another. An example is syncope. Instead of just learning a pulmonary embolism or DVT in silo, which is by itself, USMLE would not test that because that's not real life. You're not going to get a pulmonary embolism just in a silo. You're going to get a presentation, which is a syncope-like presentation, which can have multiple clues. And this could be an MI. This could be a pulmonary embolism. This could be pericarditis. This could be heart failure. This could be from, let's say, hypovolemia because of diuresis, hypovolemic shock. This could be septic shock. So the USMLE is testing you on the ability to form differential diagnosis from a central presentation that they'll give you, and then being able to eliminate different answer choices based upon the clues they'll give you. No other resource will train you on this skill set, the ability to remember these, compare and contrast, remember these, and the ability to rule out these differential diagnoses and form them, than a Qbank. So that should be the mainstay of all your prep. The singular biggest mistake I see with people is that they'll do every resource on the planet, but they'll do just one Qbank, which I think is so stupid, because you're never learning how to learn even the right way by using a Qbank, like I showed you, using the system I showed you, and never learning the elimination systems that actually matter on the exam. So the main premise of your preparation should be Qbanks. I'll talk about which banks are and which ones are not. Second is also increase long-term retention. The reason they do this is because of this. So if I were to ask you, what do you remember more of? Is this something that has happened in real life or something you've learned in theory? Likely it would be something that's happened in real life for you. Just let me know in the comments. Like, some people might say theory, so I might be wrong there, but what do you remember more in life? Anything you've memorized? Is it something that you've seen in action, patient presentation with DVT, or is it something that you've just read? What do you generally remember more? Why? The reason it's the case is your brain doesn't have the most resources. It's constrained. It doesn't want to waste energy. So your brain is always trying to protect energy expenditure, because evolutionarily we've not always had food. Your brain is always trying to optimize for survival, for things that matter, and trying to take out things that are going to hurt your chances of survival. So if you've just learned it in theory, if it's never happened in real life to you, your brain will tag it as low priority to remember. I'm not going to waste my time remembering this because it doesn't matter. What is if it has happened in real life? Your brain knows, okay, if this has happened in real life, that must mean this knowledge is necessary for living life and for survival. That means it's prioritized high. So Qbanks do that. They show you things in action. We just saw this case of syncope. It's almost like pseudo action if you think of. And because of that element, because of it almost like happening, you're seeing the presentation, you're seeing it manifest, triggers the brain into, oh my God, I just went into a scenario where this lady had the syncope because she was on a diuretic and she had these many conditions. So Qbanks are the only part where you trigger it versus learning theory using just Anki, using just something like Post-it, right? The next thing is Qbanks use what we call as encoding variability. What is encoding variability? Let me ask, when you were learning your language, let's say you were learning English and you were learning the word hero, did you go home and revise hero like 100 times in order to remember what hero is? Or do you find that as you were growing up, somehow you just picked it up without even revisions? What was more true for you? Did you need to revise the word, like the word in the English dictionary, hero, over and over again by going home and saying, oh my God, I'm going to revise hero this week and this week? Or it just fell into place somehow? What was true for you? So I'm reviewing the comments. Fell into place. Why is my question. The answer to this is not, some people might say because you're using it. The answer is that's incorrect. You don't use Hero a lot. You're not like telling yourself I'm going to use Hero this, then, and then I'm going to learn this word. No. The answer to this is encoding variability. What is encoding variability? Encoding means the way information is imprinted into your brain. What ends up happening with the brain is, see, the brain is optimized for survival. When it sees that one fact like Hero, let's say, it is being shown in reality to it in multiple conditions. So for example, you read a book which had this title called Hero. Then some of your friend talked about a superhero called Spider-Man. Then some other person that you met was having another conversation about Superman. Then you read a comic about Hero. Then you watched a movie. So what ends up happening is, because there are so many contexts, you're seeing the same word in, your brain thinks, oh my God, this is important for survival. This is similar to, let's say you encountered a fruit 100,000 years ago, and that fruit was tasty, it was nutritious, versus a fruit that you just thought of. Which one would you remember? The fruit that actually existed in reality, which you found in multiple different places because it was pertinent to survival. This is called as encoding variability. What that means is, the more you can vary the context in which you see a certain piece of information, the more chances your brain is going to remember it, and it's just going to fall into place, and you won't need revisions because your brain thinks it's important for survival. So tag high priority and remember it, don't forget it. And that's how a lot of the things that you remember actually fell into place, because it was seen in multiple contexts, and that's therefore you remember them. There is no other single resource that leverages encoding variability more than Qbanks, because you're going to see different presentations of diabetes mellitus, let's say type 2. You're going to see gastroparesis, you're going to see peripheral neuropathy, you're going to see HHS. For DM, you're going to see type 1, like whatever, DKA, you're going to see the same, like multiple presentations. So when you see those multiple presentations in the Qbank of a single disease, which is diabetes, versus something like first aid, where you're just going through it passively, your brain doesn't require as much as hard work remembering diabetes from a Qbank because of encoding variability. Because of the same thing, reason, you're able to remember Hero, your grammar. It just fell into place. Qbanks do the same thing. And when you do multiple Qbanks, it's magical because you don't need revisions anymore, because you're going to see diabetes present over and over again in one Qbank, then another Qbank, then NBME. So instead of revisions, which take a lot of time, which are boring, what you should be optimizing for is, how do I vary whatever I'm learning, right? The presentations of this by seeing it in different scenarios. One of the best ways is doing multiple Qbanks. It leverages the encoding variability. It leads to high term retention, and it is actually what the USMLE is testing you on. And then you also see a lot of variety of clinical presentations, which is presentation variability. Diabetes type 2 doesn't present the same way in everyone, which first it might not mention. It might only mention the most common presentation, but the variety of clinical presentations of TB, let's say gastrointestinal TB or cardiac TB or TB of the gut or TB like meningitis. So you're going to see that in a Qbank more than you will see that in every other resource. And that's why I think they should be the mainstay of your preparation. So many of you would have started with UWorld as the mainstay of your prep. I think that is not a good idea. Let me tell you why. Let me ask you a question. If I were to ask you that you don't have any driving skills yet, you don't know elimination, you don't know any of these skill sets yet, and I would ask you that, hey, you know what? This is similar to going to an F1 race and not knowing driving for the first time. You're telling yourself that, you know what, the way I'm going to learn driving is I'll go to an F1 race, I'll do one race, I don't know any skill sets, I'll just sit there and I'll learn driving. Let me ask you, would that be plausible in the comments? Learning driving in a F1 race against other racers. Do you think that would harm or that would help? No, harm. Because what ends up happening is you need a core level of skill sets, which is driving skills, basic driving skills, how to operate the steering wheel, how to operate the gear. You need those skills in order to learn higher level skills like drifting, speeding, turning on high speed. The only time you can learn these skills is if you have foundational knowledge and skills. If I were to just throw you out into an F1 race without you knowing any basics, you're going to waste the F1 race. You're going to waste your time because you don't have the foundational skills to take on the new skill sets of drifting, the skill sets of elimination, the skill sets of ruling things out. So instead of starting with UWorld, you want to start with mastering the basics first, which is using a Qbank, which I call as a learning Qbank. where you're trying to like get to an easier Qbank, which might not have the same degree of complexity, where you can learn the basic skills. Okay, steering wheel this is the most common clinical presentation, which is pattern recognition. These are the clues, positive clues, negative clues. Once you're able to learn the basic skill sets, then you can go ahead from your basic Qbank or your learning Qbank to your advanced Qbank like UWorld. And then you can take over and calibrate your skill sets of testing and the skills of ruling stuff out. Then you can do that. But before that, if you jump into UWorld, I think it's not a good idea, because you don't have the skill sets or the foundational knowledge yet to even benefit from UWorld. And it's almost like you wasting UWorld. So highly not recommended. And once you've mastered UWorld, now you can go to your biggest race, which is USMLE. But all of this takes progression. So my advice to you as you're preparing for USMLE is to use 2 Qbanks. The first Qbank is the one you start with. This is, you can do a couple of, let's say, 1,000 questions in this Qbank. This is where you will learn concepts like the basic patterns as the diseases will present. BUN is high. Where is it high? And what are the varieties? What are the differential diagnoses for BUN being high? Or syncope, what are the differentials? And apart from the differentials, how can I rule in or rule things out? I'm just starting to learn some of the basics and the basic knowledge. You're learning to apply concepts, things like pattern recognition, learning to see the clues as we're seeing yet. And the best learning Qbanks that I've found is, out of the 3, I liked USMLE RX. This is Qbank by the First Aid company. The issue with this Qbank right now is that it's not the most up-to-date to the current 2026 exam. If you want to see it for yourself, what you can see is go and see the most free 120. So they give a trial as well. You can see free 120. The most recent free 120, which is 120 questions that the USMLE will give you a sample. Compare them to what USMLE RX gives you. USMLE RX is like 2 to 3 lines, while the free 120, the latest exam pattern, is multiple lines. It's like a paragraph. So I think the issue with USMLE RX is it's a great Qbank that runs in hand with First Aid. So once you do a question, you can review First Aid after the question's over because they give you the page. But the problem is it's not calibrated to the current step 1. It's very different. The next one I really like is Amboss. Amboss is great, but the issue is, again, it doesn't run hand in hand with First Aid. Number 2, some people would tell you is it's not as high. They can give you a lot of tough questions, right, that are overly tough, that might make you overthink on the real exam, which you really don't need to do. And a lot of these are not pertinent, but these are good question banks. The third one, and again, I do have to do a self-disclosure, is StepGenie. This is a question bank that was formed about 2 years ago. And I got the world's best USMLE educators, people who had scored 270s, 280s, to work with me and draft questions. And we built an AI-first Qbank. And the way you can think about StepGenie is that it scored a 300 on the USMLE. So it's a perfect scorer. So think of somebody who has had a 300, like perfect score on the USMLE tutoring you. So the benefit of StepGenie is as you go through the question stem, the AI will break the whole question stem down for you, the way USMLE will present it and explain it to you, and will teach you the elimination, the ruling stuff out, why a certain answer is not the answer. And you can ask it questions. That's you didn't get the concept. You can ask it to explain it to you in a simpler tone, or make this more sense for me. And the other thing with StepGenie is it evolves. So as you do the question bank, it learns from what are your weaknesses, and then it will preload questions which reflect your weaknesses so you get better faster. So it calibrates, it personalizes to you rather than you trying to adapt it to it. So it adapts to you. That's the purpose of AI. So you could choose either of the 3. Again, I'm one of the creators of StepGenie, just know that. But you could try either of the 3. I think they are great. But the other thing, again, I like about StepGenie that I forgot to mention is that we've tried to make it reflect the most up-to-date format. You will also start finding nutrition questions because that's an update. So we have already in the process of launching that, where you'll be able to solve the nutrition questions with adding a nutrition module. So our goal is to make it the most up-to-date and the most intelligent Qbank that you can get that calibrates to you rather than you trying to adapt to it. So I think out of these 3, you can use either of the question banks, whichever you like, and read First Aid hand in hand with the Qbanks, plus use a course. We'll talk about what courses to use. Some people like USMLE Step on Mastery, some people like BNB, some people like Bootcamp. There are multiple courses. You can use a review course that you can work with, take First Aid, and at the same time, you're solving questions in either of these question banks. And then after, let's say, 1 month or 2 months, you're going to move to UWorld. Now that you have basic driving skills, you know how to drive. Now you can go to the F1 race and learn drifting. Learn what I just taught you, make it better as you're doing it. So I generally recommend a 6-month timeline for step 1, complete 6 months. And this is how I tell people to phrase their prep. The first 3 months are your consolidation phase. And the next 3 to 4 months. Sometimes some people bleed over to 7 months, like in the 6-month timeline. So that's why I write 4 months, but you can compress it down to 3 months. So there are three months and 3 months blocks that you're going to do. The first 3 months are called as consolidation. This is when you are taking all the information and you're trying to build the basic driving skills. So you can go to the F1 race, which is UWorld. The execution is, again, you're going to UWorld, you learn the basic skills, you're learning how to drift, you're taking the test, you're taking NBMEs, you're taking self-assessments, and you're getting better. You're refining your drift and you're refining, you're ruling out stuff. And how do you do the consolidation? So like I just said, take first aid, make sure you have a good USMLE review course. This can be, there are multiple review courses. There's USMLE Step on Mastering, which I'll talk about. This is one of the live courses I do. The other one is Bootcamp. The other one is BND. And you're going to take first aid 5 to 10 pages a day. You're going to read it along with the review course. At the same time, you're going to use what I call as QPAR, question-based first aid revision, where you're taking all your first aid knowledge, whatever you've learned, and you're trying to learn some driving. You've taken the manual. First aid is the manual, driver's manual. You're learning, okay, what are the rules and stuff. And then you're going and practicing those in the question bank and trying to get a bit dirty, learning a bit of pattern recognition, clue recognition, like I taught you. The goal is about to do 1,000 to 2,000 questions, and you can choose any Qbank. There are Step Genie, USMLE RX, and Amboss that you can go with. That's the first 1 to 3 months or 1 to 2 months. It's up to you how fast you want to do it. Once, let's say, 1,000 questions are over, right, in your first Qbank, and you think, I know some basic driving, then I want you to go do UWorld. And even one pass of UWorld is now okay. You don't need to do 2 passes. The reason that is so is because you've already learned basic driving. Now you don't, like, all you need to do is just master drifting. The issue that people run into is they'll try to do 2 passes of UWorld. I think that's a complete waste of time, because if I go back to the same question that I gave you, and I gave you the answer in this question, you already went through the question before, and you're doing a second pass of UWorld here. You already know that the answer is elevated VUN. So there is no point, because you're not learning test taking, you're not learning ruling out. The point of questions is your ability to formulate a differential and then rule out based upon the clues that they've given you, which is not happening right now because what we call as a recall bias. On the second pass that you do of any Qbank, you're using recall, which will prevent your ability to engage in elimination because you already know the answer. Your brain's not even going to do the hard work. It's going to be like, okay, I know this and I'll pick this. And then people fail on the USMLE because they're using recall, because USMLE will not give you the same repetition over and over again. So we want to avoid the recall bias. And in order to avoid the recall bias, 1 pass of UWorld is necessary along with another Qbank that you have done before. The question that if you do 40 questions a day on UWorld, that's 3,600 questions across 3.5 months, you are done. Right at the end, as you're approaching month 5, I would start self-assessments, UWSA 1, UWSA 2, and then in month 5 to 6, as I'm transitioning, every week I'll do 1 NBME. Again, you're doing as many questions as possible. That's the skill set that matters, as you just saw. The ability to form differentials and rule stuff out that USMLE cares about. So you're going to do as many as NBMEs as possible from all the way to 25 to 33. Generally, the average you should be aiming at is 65% and above score across 3 consecutive NBMEs. And once you've done that, you can go ahead and write your exam. That's the timeline that I give people. That's like, in order to do the nutrition update, I'll tell you how to do that as well. And for that, you can stay back till the end of the class and I'll teach you how to do this. Right now, as in the webinar, I just want to just do a recap. So what you've learned so far, just to give you a recap, is why the step 1 2026 is fundamentally different. There's new syllabus, there's nutrition coming up, there's ethics coming up, question stems are longer. And I gave you systems that would help you partly handle some of this. Number 1 was ruling stuff out. And this is going to help you, the system of elimination, across all 280 questions and 320 questions on step 2. So 280 on step 1, 320 on step 2. So that's very actionable, which is going to help you cut through the noise and come to the answer and make sure you're doing your best to pass. Second is the hyper reading, which is again going to cut down reading time and increase your score. And especially in an exam where question stems are getting longer, it's going to really help you cut through the noise and increase your thinking time and solve things and not run out of time. So it'll help you do the time management. System 3 is I gave you the complete 6-month blueprint. The nutrition update is something I can't control because people are asking me for resources. And what I can tell you is, again, we'll go towards the end, is how I can help you with preparing for the new exam if you want to work with us. And we'll discuss that as well. But nutrition update, again, if you have any resources, you can go through with it itself. If you want to work with us, we can cover that because we control some of this. Step Genie also has a nutrition module that will be coming out. If you choose, go ahead to do and choose the question bank. Otherwise, I would wait for what the other companies are saying, and that would be up to you. And the same system has been applied to multiple students, as you've seen. and transformed their entire journey, the system 1, system 2, and system 3. And what I've made, the way I've designed these systems is, even if your IQ has been termed average, if you just use these systems, you will perform brilliantly on step 1 and step 2. I've taken people from fails like 190 to 190 that they were getting on step 1 before, all the way to 250, 260s, and within a span of a couple of months. I just want to ask before, again, I promised a gift that I'd be sending to you as well, which is the match predictor. I want to ask you in the comments, as we have gone through the webinar, this masterclass, just to get feedback from you. Do you find that like this signal to noise framework for elimination, could that work for you? If that's true, type a yes in the chat. Do you find it actionable? Do you find it immediately actionable? Okay, I see a lot of yeses. Awesome. So I'm glad. If it's a no, tell me. I'll take the negative feedback, and that's completely okay. Second is, can you see yourself doing questions in 60 seconds at the least, if you just use hyper reading? Awesome, which is going to save you time, 140 minutes more on the exam, which is 2.7 hours, right? Which is a lot of time. Does the 6-month blueprint fit your timeline, like whatever I gave you? And did this make you want to stop being a prisoner and be more excited for the exam? Not being like hunted by the exam, but rather you want to hunt the exam, like using elimination. And did this want to make you again feel like an assassin? I need to hunt the exam rather than being hunted by the exam. And were you glad that you stayed to learn this? Type a yes in the chat if that's true for you. Awesome, awesome. What I want to tell you now is, a lot of you came here just to look at some of the webinar and just take a few bits from it and go apply. But a lot of you I know are very interested in working with me and my team in order for you to not just pass on the step 1, but crush step 2 and match into your dream specialty. A lot of you I know are interested and ask those questions. If that is you, if you're interested in working with us and you're interested in seeing what we have for you in order to help you crush step 1, crush step 2, and match into your dream specialty in the shortest possible time, you can stay back. That's not, you're like, hey, I just wanted to look at what you were teaching and I'm not even sure about USMLE. You can leave. That's completely okay. And we'll be sending you the free tool anyhow. But if that's interesting to you, that, hey, I want to work with you, I just want to cut down my time to reach to the match into my dream specialty and start building from here. If that's, you can stay back. So what I just gave you, by the way, is just the 15% of the complete system that we have. This is just like the very basics. You can go very advanced in the system. And not only that, with the match as well, I'll talk about we do that. Imagine if you can have the complete system 85%, like someone to walk you through the entire system, the implementation of all the system 1 that I taught you, implementation of hyperreading, and implementation of system 3, which is the complete blueprint, which is including the nutrition update and all the things, and all in one. Imagine if we could do that for you, because that is something we can do. So right now, I feel a bit uncomfortable because I need to change my my hat from being an educator to somebody who's going to show you a product, and this is part of sales. And I think that has saved the life of many people, as I will show you, preventing them from going unmatched, preventing them from failing. And I think so that's very important to discuss this product. That's like my moral responsibility. So I will share that with you. And we generally have limited spots for this. Right now, like we had 40 to 50 spots before, and it ran out in a week to about 17 spots. That's what we have left. So what we want to do for you is, if you want to work with us, is imagine waking up the day before your exam, the day before even the match, knowing that you nailed it with zero exam-related self-doubt, zero anxiety, zero dread, and no more resource overrun. You're not making 100 decisions on what resources to do when, and then really worrying about the match, which is you need about 8 publications. If you look at the data, 8 research items, 8 publications, in order for you to match in the end, right, into your dream specialty. And this is for internal medicine. You need 3 research experiences. You need to do multiple other things for the match. Imagine not worrying for any of this and just focusing on the exam and knowing exactly what will be tested and what's the most important without any garbage. How would that look for you? Would you be excited for step 1? Would you be excited for step 2? Would you be excited for the match? Or the opposite? Hopefully you'll be excited if we can take over that stress, we can take over that load of everything else that's bullshit, which is deciding between what's important, what's high yield or not, deciding between what resource to do when, deciding between how do I figure out the publication, how do I figure out everything else that's required for the match. If we can take that headache over and you just focus on the exam, how amazing would that be? And this is where it brings me to the path of what many applicants go to, is the path of the USMLE prisoner or the match prisoner, is that they're trying to go through this journey alone. They're trying to implement everything alone. So everything I taught you, what's going to happen is, mark my words, the system 1 elimination that I taught you, system 2 that I taught you, hyper reading, System 3 that I taught you, which is the blueprint, 95% of students here are going to forget that completely. Let me tell you why. Let me ask you in the comments as well, whenever you get a Ferrari, and let's say you have your current car, when you first drive the Ferrari, right, the first time, and you're transitioning from the current car that you have, do you think it would be easier to drive the Ferrari when you're transitioning compared to your previous car, right? Or would it be harder when you're trying it for the first time? What would be easier to drive whenever you're making the transition? Is it something that you're already used to, your system that you're already used to, or is it's a completely new system that's faster, but it's a new system? It's harder, of course. That's exactly the problem. So what we find is a lot of the times we give students these systems, but these are incredible systems. So the problem is whenever they make the transition from their old system to the Ferrari, the faster system that's way better, what ends up happening is this. Whenever you implement any new system, you're going from your new car to your Ferrari, and this is your performance. So this is your old car, and this is the new car, which is the Ferrari. Your performance is going to go down slightly because it's a new system. You're going to be uncomfortable with hyperreading. You're going to be uncomfortable with ruling stuff out, with elimination, with everything else. You're going to get a little bit worse, and then you improve significantly. Versus if you never make the transition, you're just going to stay here and maybe improve marginally. So in order to help you, this is what we call as the J curve. In order to help you with this, again, we have designed a whole program in order to take you through the J curve, in order such that you reach a point where you're excited about the steps, where you're excited about your math journey, not overwhelmed, not struggling with hundreds of decisions. So the path there's path 1 that you can take, which is trying to implement all of this alone, trying to do it in trial and error, doing it by yourself. What could have taken like a couple of days would have taken like months to years for you to do it yourself. Maybe get a 230 on step 2 and take multiple years to match. The reason I'm bringing this out is because students have so much allostatic load, which is they're struggling with exam prep. Now they have to build an application that leads to, especially if you're an IMG, the match rate for IMGs, non-US IMGs, is currently 46%, which is half of you sitting here. If you apply for the match, less than half of you are going to match. More of you will take at least 1 year. That's the data. But even that is incorrect, because if you correct the data, the NRMP, the way it reports the data is they show it is a 46% match rate for IMGs, but this is based upon the number of applicants matched divided by number of applicants who have submitted a rank order list, which means they got at least 1 interview. Not everyone gets an interview. And if you count in people who never got an interview in the denominator, so number of people who matched by number of people who did not get an interview plus got an interview, which is the number of people who applied, the match rate drops to 36% because 25% of people will never get an interview. And when you adjust the inflated number, the 46%, which is only counting from the denominator, which is number of people who got at least 1 interview, if you counted the 25% who did not get an interview, the match rate drops to 36% for the most IMG friendly specialty, which is internal medicine. And one of the reasons, again, is the path of trying to do it all alone, figuring all these things out. And when you're trying to do it all alone, you can't focus on other aspects as well, building a match application, to help you match on your first attempt, which includes having at least 8 publications or 8 research items, which also includes, apart from that, 3 research experiences, multiple volunteer experiences. So it's very hard to do it in concordance unless you have somebody else working with you to build all of this together for you, so you can just focus and match on your first attempt. So I want to share examples with you. Again, the reason I share this with you is because I've seen applicants struggle for not just 1 year. This is an applicant who reached out this year, who couldn't match in even their second cycle, as you can see, and she's depressed. That's why she reached out. And the second person is a person who is working as a research coordinator, and he went unmatched in his 3rd math cycle, as you're saying, and is going to apply for his 4th math cycle. So the path of trying to do it alone is what this leads to. Is you're trying to do it all alone, your match application gets ignored because you're so much stressed. You have to deal with, okay, what resources to use, what not to use. Publications get ignored, and the whole application's bad. And then applicants take 2 to 3 math cycles to match. And if you estimate the cost, how much does it cost to go unmatched for 1 cycle? So if you look at the cost is, number 1, residency salary, 1 year that you go unmatched. You're losing about $70,000 every year you go unmatched from the residency salary that you've gotten, plus you're adding $15,000 to $22,000 in reapplication cost of doing rotations again, doing more research, traveling to the US. So if you combine that every single year that you go unmatched, these people went unmatched, they're losing $92,000 per year that they could have made. What if, again, we could give you a different path with USMLE Wise, where we take care of all the headache. All you do, like in this journey, like to the US, is just like a first class flight. All you do is just go focus on your exam, do your best, and let us handle the rest. That's what we built for you, which is the path 2, which is the USMLE Assassin path, where somebody will walk with you to take you through the J curve, get you better, make exams fun. Step 1 fun, step 2 fun. Apart from that, we already have what we call as a match membership, where we help you build your entire application. I'll show you the amount of people who've used it and they have loved it. And because of this, students who work with us, almost all of them, I'll show you our match rates. It's about 100% if you don't have red flags, 88% if you do have red flags, even if you're an IMG, and 100% for everyone else, US IMGs and whatnot. We're able to save applicants about at least $92,000 in saving because they match with us 1 year earlier. So not only do we help with USMLE prep, accelerating you through your USMLE prep and making it easier, because we already know what's coming. We know the nutrition update. We can update it because our students are sitting on the USMLE all the time. So we have very good access to meta-analytic data for that. And because of that, again, that's the amount of savings we can bring to you. So I want to introduce you to our program, which is USMLE Step on Live Mastering. If this is, again, someone who wants to work with us. This is a live program. Already 12,000 plus students have taken it. Our pass rate is 99.3% on your first attempt. And this is basically 111 live sessions. And this happens over a span of 6 months. And during these 6 months, we take you through the entire syllabus of USMLE Step 1 and the most up-to-date syllabus, including nutrition, including ethics, including the microsurge, including the HPI questions. So we already have the best test takers in the world, and I'll show you who these are. Like we've scored 270, 280 on Step 2, and they are the ones who are teaching the course because they're most familiar with the most up-to-date format of the exam. And you do it over 6 months. We generally host sessions. It's 4 sessions a week. It's generally Monday. I'll show you the exact timing. It's Monday from what I remember, Monday, Tuesday, Thursday, Friday, but I'll show it to you. And it's 1.5 hours per session. And these are live sessions where you will be interacting. It's a group live session where you can interact, ask your doubts, and we'll also be building your basics. If you struggle with basics, a big thing that I get from people is, Manik, I struggle with basics and I'm trying bootcamp, I'm trying BNB, and I don't have basics. I don't know what to do. We will be covering everything from the basics all the way to even reviews that you will be getting, right, in this course. This is just our pass rate, 99.3% pass rate. Our average step 2 score for the students who go through this is 250 plus. We annually update it. Now we have even started updating it every 6 months because of the amount of updates USMLE is having. And all our teachers have minimum of 270 plus on their Step 2 in order for them to teach you Step 1 and also give you frameworks for Step 2 as you're studying for Step 1. So the transition is easier for you. And our main mission is to take you from feeling like a USMLE or a match prisoner to a USMLE assassin. How are we different? Again, if you go with us, is other courses are pre-recorded videos. These are live cohorts with recordings. If you miss anything, you'll get access to a platform where you get lifetime access to all the recordings. In other courses, if you go with them, there's no live Q&A, there's no real-time support. You can't ask questions, you can't figure doubts in real time. In ours, you'll be able to ask questions, ask doubts in real time. Other courses are partially updated. If you go to like other courses, they have not inculcated even the nutrition update or whatever updates they have. We have already done that. It's already in place. My USMLE tutors have already made a module for that. So you'll be getting access to that versus in others, that's not there. Others assume that you already have basics. So a lot of courses like BNB Bootcamp assume that you have the basic foundational knowledge, which a lot of students don't, especially IMGs. We don't assume that. We have built it right from the basics. So you don't even need to know anything in order to get a lot of value and learn from this. And we are going to take that basic knowledge and evolve that into even a high yield review. So you're covered in both ways. That's how we have made it. Instructors of others haven't really scored 270. So I don't understand how they're allowed a lot of the times to teach on these exams, teach any of these syllabus because they themselves don't have the results. So what we have done is through strict interviews, we've only gotten the best of the best across the world, people who've scored 270s. And not only that, they are extraordinary teachers. And lastly, if you go with us for the Step on Live Mastery, We will also build in a foundation to get a 260 plus at the least on your step 2. Everyone who goes gets a 250 plus, but our goal is to get you a 260 plus, and we'll be building those concepts while you're going to the live mastery so you're able to transition easily to step 2. And we come with a pass guarantee, which others don't, which means we'll work with you until you pass, and we won't give up on you. And you don't have to pay us anything extra. You'll never be alone in this journey. You'll get WhatsApp group access where you can ask your questions to the tutors, and you'll have direct access to this. Every one of you who will go through with us will be directly monitored by me as you're going through your journey. So we are planning out your journey from step 1 all the way till the match, which you'll get free access to. You don't have to pay anything for that. And you'll get a community of people who are serious, not people on Reddit who are talking bullshit nonsense, right? And they have no accountability. You'll get people who are really in the game and they want to match. And you'll get people who are more intentional and they want accountability, right? Which is a very different cohort on how you can go through USMLE. One cohort leads you to the result way faster. The other cohort slows you down with the amount of nonsense that they'll put on. And again, we come with a satisfaction guarantee if you go with us, which is we don't give up on you until you go ahead and pass your step 1. And if you go with us with the match, I'll tell you about those as well. We don't give up on you until you match as well. So how much do you think this course should be worth? Given that we can save you about 1 year in residency salary, we can save you an extra math cycle just by accelerating the whole prep. At least I would put a $92,000 price tag if I'm saving you just 1 year. Most IMGs can take 2 to 3 years to match. If I can just save you 1 year, that's worth $92,000. How much should this be worth? This is 111 live sessions delivered Monday, Tuesday, Wednesday, Thursday, 1.5 hours each. They are live with recording access. We cover the 2026 syllabus. Instructors who've just sat on the USMLE, all of them are 270 plus scorers. You'll get first aid notes. We have our own note series that you'll get access to. These are built for the 2026 exams. We'll also have live question solving. So you don't even need to do another Qbank. We will be the other Qbank that you will be doing. Instead of even doing Step Genie, we have already implemented Step Genie questions in the series. So we'll be solving questions with you instead of you taking another Qbank. And all you would need is a UWorld subscription. That's all. Right? And you will also get access to our USMLE-wide self-assessments, which include the nutrition update for anyone who's taking it in June as well. So we already have those assessments, and these are about 95% accurate in predicting what your score will be. And we capped the cohort. Right now, we have 17 spots. The total value of this is $3,499. And what I decided was I wanted to add more value to this, and this is how I'm adding more value beyond the $3,499 is we're giving you full-time access, lifetime access to our platform where all these recordings will be. Our notes, which we charge $299 extra for, you'll be getting that along with the $399 for like in the $3,499 course. You'll get our question solving frameworks, which is $349. This is our Qbank, which is a video Qbank, where as you go through the live sessions, we'll be solving questions with you after we do each topic. So you start building some of those basic driving skills. We'll give you access to Sketchy. You'll also be able to ask doubts to these 270 scorers, and that's itself worth $249 like tutoring sessions. So you're going to get the access to that. Sketchy itself is worth $349, and you'll get access to our self-assessments, which is $98, 2 of these, and CAT community cohort access, where we'll be answering all your questions. That itself is $149, plus you'll get a pass guarantee, which no one else offers. I think that's priceless, and all 2026 syllabus will be included as well. So the total value, if you count, that we are giving you the course for $3,499. The total value of this is $5,391 that you're getting for $3,499. And I do want to iterate. So what else could I have included in this? Many students are like, Manik, can you deliver more? So I was like, why not deliver more? So what can I give you more for what you're already giving us? So the uncomfortable truth about IMG matching, as you already are very aware, if you look at internal medicine match rate, it's 36% for the easiest specialty that you'll apply to. If you go for general surgery, it's way harder. It's 20%, 28%, even lower. So the question I asked myself was, Manik, how can I make it even more worth it such that this becomes a no-brainer? So what we have decided to give you is access to our Autopilot Match AI. This is our own artificial intelligence software that we built using 35,000 application data pool. So the way USMLE-wise works is we have the access to the biggest data pool of applicants, even bigger than NRMP. And because of that, we've been able to take their data and then feed it into an AI model that can give us predictions to if somebody had a step 1 attempt and they had a very old YOG, what did they do to go ahead and match? And are there other applicants which are also in this other eccentric nature, where they had step 2 attempt, but they were able to match. What did they do similarly? And because of that, we're able to build a whole plan from you all the way from step 1 till the match, that what you should do, what you should not do, where should you go for a rotation, where should you not go for a rotation, what kind of a research publication is good, what kind of a research publication is bad. All of that headache is now ours. You don't have to take that headache. So this itself is worth $1,500. It's part of a match package, which we give to all our students, which helps you build the personalized roadmap from A to Z. You're going to get that for free if you enroll with us, right? Where you get free guidance for whatever rotation, research, and CV strategy that's built in, that's required for the match. So you're not part of the 36%. Apart from that, I was like, Manik, I want to deliver even more value. How do I even outperform? We'll also give you access to our USMLE First Attempt Match System membership. This is a 1-year membership where you will get access to all our courses for CV building, for research. This is case report, original research, whatever you name. This itself is worth $2,220 per year that students pay us for. So you will get access to that to help you build your PS, interviews, research, all of your CV items for you to match, so you don't again fall into that 36%. My goal is not to just make you pass. My goal is to get you to go to residency. And you get full application strategy with the USMLE Vice team, plus you get access to our live courses. So a lot of these are pre-recorded courses, but we do live courses, so you don't have to pay anything else for that. It will be included in access for about 1 year so that you're covered. Apart from that, I wanted to go even far, and I was like, what else can I deliver? So we have included our crash courses, which students pay us $199 for each crash course for step 1 and step 2. These are high yield review crash courses that you can just do in 10 days, and you will review everything. It's about 70% of what is tested on step 1 and step 2. This doesn't include the nutrition update yet, but I think these are great. These are $398, and you're going to get access to these for free. Students who work with us, I just want to show you a couple of testimonials, case studies of students who work with us and what we have been able to do with them. Is this year, 100% of non-US IMGs, if you don't have a green card or you have a green card as well and not citizenship and you're applying, that's a disadvantage. 100% of them were able to match with us, provided they didn't have red flags. And when I say red flags, I'm not saying extreme red flags. Even let's say if somebody has slightly high YOG, which is 3 years, that is not a big red flag. So we have not covered that in the 100% match rate. If you had a 5-year YOG, which is a very old IMG, this is IMGs with year of graduation of 2018, or IMGs with like year of graduation being 2010, or somebody who has step 1 attempts or step 2 attempts. If you have an attempt, our IMG match rate this year was 88%. I'll show you again, this part of this is Autopilot Match AI, which is using meta-analytic data from multiple applicant pools, and then using that to synthesize your roadmap, where to go, where not to go, where to network, how to get interviews. That's why the numbers are so high versus what you would see, which is 36% versus what we're able to get for our applicants. And if you're an MD, DO, and US IMG, our match rate is 100%, regardless if you have a red flag or not really. And the reason these are so high, again, bringing this to the light, is because of our Autopilot Match AI, where we have analyzed data from about 35,000 plus applicants, and because of that, our predictions are 96% accurate. And because of that, we have been able to build a personalized roadmap from step 1 all the way till the match, so that you're not in the limbo of what should I do next. These are some of the case reports of students. Many of them have attempts. This person had a step 2 score of 218, and she just matched. And if you want to see a video or talk to her, we will be happy to put you in touch with her. But there are many students that we've worked with over the years that have matched. And somebody like this person applied the second cycle. This is his second cycle. And the first cycle, he didn't take any match services. And he went unmatched the first cycle. He worked with us. This time, he matched into Mount Sinai, which is a very prestigious program in New York in internal medicine. And he took the PS services that we provide and whatnot. So I'm glad that we were able to make that difference. But many of this person has a step 2 attempt and she was able to match. Given that the value of everything that I just told you, the value of that is close to $9,500 if you include whatever are the bonuses. But because we have been so successful over time, what we have ended up doing is, because we want to scale, we want to help the most number of people possible. Over the past year, we have decreased our pricing to $1,999. And I've worked with multiple USMLE tutors to take over my responsibilities. These are people who have 270, so they can affect people at a bigger scale who can afford what we have provided. We've been able to reduce the pricing to $1,999 as of last year. As of this year, because we wanted to do even better, again, our goal is we want to advance medicine all across the world. We want to help the most number of people possible. We were able to reduce it to $1,299 using technology because we've been able to build platforms, and it has made things easier for us because we want to deliver a lot of value to anybody who wants that help with us. However, because you stayed, we've reduced the price from $3,499 to $1,999 for the course that I'm showing you, to $1,299 as you're seeing right now. But because you're here with us, we're reducing it to $899 just for the webinar. This pricing is not available to anybody else but you. And what are you going to get for this? Let me just show it to you and show you these platforms in action. Right, you're going to get the full USMLE Step 1 Live Mastery, which is a 6-month program where we take you through the most up-to-date syllabus. It has the Qbank, which is the video Qbank that you get access to. It has the notes. You get to ask any doubts, any questions. You get lifetime recordings. So the course itself is worth $3,499. Lifetime recordings plus 2026 notes plus frameworks is worth $1,047. Sketchy, live Q&A. Sketchy is a visual mnemonic platform. So live Q&A, which is doubt solving. 2 self-assessments plus cohort access for communication is worth $845. You're getting a bonus, which is Autopilot Match AI. This is lifetime access. So you can build predictions of what would be the best path forward. This is $1,500. You're going to get it for free. You're also going to get the 1-year math system, which I'll show you our platform as well, how that works, where you'll be able to watch courses and build your CV in real time. Plus, you will get access to our crash courses, which is worth $398. So the math system is worth $2,220 per year. You're going to get that access. And the Autopilot Match AI is worth $1,500. Plus, you're going to get a pass guarantee. So all of this, if you price it down, is $9,509 in value. That we've been able to bring it down to $899 because you've stayed, you've showed us that you want to improve. I think you'll be very successful if you work with us. However, I do want to emphasize, we only have 17 spots. We have about 50 spots per cohort. We have multiple cohorts running. Currently, we ran out of the 50 spots. We ran out of about 33 spots as of last week. And we'll be starting on May 5th. That's when we start our next cohort. We only have 17 spots, and I see there's 217 people. And I won't be able to work with every one of you. And if you're not able to get through this, I'm going to put the Stripe link. It's a $99 deposit if you want to work with us. I'm going to put the Stripe link. I'm going to show you the platforms in action as well, how they work. If you want to enroll, we only have 17 spots for the May 5th course that we are starting. Right after that, it could be a 3 to 6 month delay for starting the next course. But this is the only offer that we have for the only 17 students, and it's first come, first serve. So I'm going to put the Stripe link, and I'm going to show you the platforms in action. Okay, I think so. The Stripe link is already mentioned. Sorry, yeah. So yeah, we've already pinned the link as well. So let me show you the platforms in action. I'm going to stop my screen sharing. Okay, I'll start sharing my screen. I think you should be able to see my screen. So what do you get for this? I think I've already explained this, and I'll be happy to explain it even more. Let me open my, okay, I think it's, okay. Let me open this. Okay, so how do the platforms look like in action? So let me just show this to you. Okay. Okay, this is an example of our math system platform where you're going to get access to like our crash courses. These are our rapid research courses. We have courses on how to publish case reports in 7 days. This is done by Kaushik Sriram. He is a UPMC researcher originally, and he has grants worth $7 million that he's taking care of, and he's a genius at teaching research. So I got the best person in the world to teach research. So you'll be able to start from the basics, which is how to write a case report. Then you'll be able to go to the interim, which is how to do an original study in just 30 days using artificial intelligence. We'll be teaching you the entire fast track to US research masterclass, where if you have zero basics, you don't even know what a case report is, we're going to do that for you. These courses are bite-sized lessons. So you'll be able to complete these courses pretty easily. Some of these courses are 2 hours long. Some of these courses can be 8 hours long, but you'll be able to build that. We also have courses on rapid research masterclass, how to go to a match-worthy publication that will get published in just 60 minutes with AI. So you get to the research item number, which is 7 to 8. I also have masterclasses on how to craft a personal statement, because as you would know, if you look at the data, 80% of PSs, 80% of PDs say PSs are important, and many PSs are so bad. And that's why you will see people with 250s, 260s go unmatched. And I'm not joking, is because how bad their PS is. So we have the world's best course on how to craft an interview-worthy personal statement masterclass, and it will be very actionable. We don't give you anything that is theory. everything that you'll learn with us is immediately actionable, as you just saw. And we have masterclasses on how to craft your match application when the time comes, how to interview, which is not taught. You're going to get access to that. And if, let's say, somehow you end up in, which doesn't happen with us, but if it does happen, we have courses on that you can do. And this is our platform, which is the USMLE Wise platform that you'd get access to for 1 year. What else can we give you apart from this? So this is just the few amount of people who have worked with us. And this is our match membership that I was talking about, apart from the platform access. And this, what we like, apart from these courses, you're going to get live course access to any updates, to interviewing, to research. We do like a new research course every month at least. So you're going to get access to that for free. You don't need to pay us a dime extra. And any new CV building course that you want, like for example, ERA CV, how to build my CV, what kind of a volunteer experience should I do? We will have courses for that. So we will get you to the publication, whatever, which is 8 research items by that time. The alone cost of this membership, if you look at the individual courses that students pay us for, this is the advanced interviewing, PS3X, ERA 3x course, match application strategy, case report writing course. Hopefully I'm audible. Original research course, private WhatsApp community. Students alone pay us bookers amount of money for that, but we'd be able to bring it down the $2,200 cost for you for free. Generally, again, right now we have an offer that's running for $279, but you have that for free if you join with us. This is the course, by the way. This is how it looks like. Let me just do a zoom. So this is USMLE Step 1 Live Mastering, which is designed for the current USMLE Step 1 with the nutrition update and all the ethical questions update. And this is the only, again, 6-month live course that covers the updated 2026 syllabus in live. Our pass rate is 99.3%. We've been able to have the success with 12,000 plus students, MDs, DOs, US IMGs, non-US IMGs. And we cover even questions. So you should get like the Qbank, video Qbank in it. And as I've discussed, it's going to be 4 days a week, Monday, Tuesday, Wednesday, Thursday, with 111 live sessions. And by the end, you'll be able to point to every page of first aid, and you would have at least that covered, if not more, which is the nutrition sessions. Everyone who's delivering here is a 270 plus scorer. So this is how it looks like. And this is how the syllabus will be distributed. We'll start with cardiovascular system in May, then we'll go to the GI system in June. And then in July, we'll go to the immunology, hematology, and oncology. So June also has other systems like GI, renal, endocrine, and reproductive. Forgive me for asking, for saying this like multiple times. I'm just a bit tired after the whole masterclass. In August, we'll be covering neurology, psychiatry, MSK. In September, you'll be done with dermatology, biostatics, ethics. In October, we'll be covering microbiology and biochemistry. And lastly, November, we'll be covering general pathology. So by the end, you will know 100% of what is very high yield and is likely to be tested on the most current up-to-date USMLE Step 1. And this will be, again, with me and other tutors. I personally have mentored close to 12,000 plus students using this course. If you look at other courses, just like group coaching and all, it's 19,000 plus. But just using this course, it's been like about 12,000 plus students. And again, I have tried to design the most superior course possible and deliver the most amount of value. And this comes with the pass guarantees. There is no way you can lose, right? Along with the match membership. And this is offer, the $899 offer is just for you. After that, the price will go back just for the course to $1,299, and it would not include access to our membership, as I just showed you. Okay. So this is the membership that you're getting for free, which includes all our courses that students take. And apart from that, the whole platform access will not be there for anyone who joins afterwards, because that, again, this is only for somebody who's joined the webinar and has shown interest. So we don't offer this to anyone outside. We know if we work with us, we're pretty sure we'll be successful. So I see that there's a lot of questions. Before I answer those questions, I just want to run you down a few things, because a lot of students get confused and they're like, hey, Manik, can you explain things to me a bit more clearly? Let me just 1 second. Okay, so as you can see right now, the investment right now is $99, which is to book your slot. We will start on May 5th. Generally, like the timings would be about 7:30 a.m. IST, that's 10 a.m. EST. And if you are unable to attend, you'll be given recordings almost like within 24 to 48 hours, they'll be uploaded. So you can review these and you can keep yourself on pace. And we'll be covering like a whole Qbank as we go through this as well. So you get the Qbank practice plus review of all step 1 from the basics to the advanced. The full-time gain payment, once you make the $99 payment within a week, is about $899 as a full enrollment. And there's zero risk. If for some reason something happens, we'll extend this for free for 6 months. If let's say you don't get the exam in 6 months, you don't have to pay us anything extra because we want to be there with you until you match and until you pass. And we won't quit on you if your score stalls. You'll have access to tutors who will work with you to get your score up and to the point that you score a 260 plus on step 2. Why do we have limited capacity? A lot of you might be asking. It says 40 students, now it's 50 students. We just changed that recently. And we do this because, again, we want it to be more one-to-one. We find that the more we dilute the cohort, the worse it gets. We keep it we run multiple cohorts, but like we run a few of them, but in one cohort, the appropriate amount is about 40 to 50 students that you're going to get. And it allows for more interaction, for more doubt clearing.
Okay. Yeah. Okay. Yeah. I will personally review each person's progress as well. That's another reason it's very like the capacity is limited is because it takes a lot of time for me and energy for me and my other tutors to review your entire journey all the way from step 1 to the match. And how do you make your deposit? Let me just show that to you. So when you click on the link, let me go back. So when you click on this link,
you can click on the mastery link.
Yeah, so yeah, when I click on the link here, you can even go to the master link. So let's say I click on the link, or you could go on the striping, it's up to you. So this is the webinar offer, and you can just click claim my webinar offer. And once you click the webinar offer, you're gonna be taken to this page, and you just put, this is a safe page, this is through Stripe, and we don't have any of your information. It's a third party that processes it, which is very safe. You just put your email, your address that you might have. You might don't. If you're in the US generally, I think you have to put it. If you're from the outside, maybe not. You put your card information that you would see here and just click pay. And once it's done, our team would reach out to you within about like 24 to 48 hours and get you enrolled and onboarded. And that's about it. And just to do a bit of a Q&A, because a lot of you might be asking, how fast will I see results? So anybody who joins us is able to see results within 2 to 4 weeks. You just saw, like in this masterclass, one student was able to go from not knowing the answer at all to immediately figuring out the answer just by ruling stuff out. That's just one class. Imagine what could happen over a couple of months, the amount of improvement. So in weeks, I'm pretty sure you should see at least a 20-point increase in your score if you just join us for even 2 to 4 weeks. And the rest we generally extend to step 2. Let's say if you're in your step 1 prep and you join us, what would happen is you have 3 months. We would extend this to step 2 mastery, which is another course we do where we cover the entire step 2 using questions. So that itself, you will be converted over so you don't waste any money there. If you have less than 6 months exam before your exam, this should work perfectly. We have many students who only have, let's say, 3 months. So what we end up doing is we cover what is the most important that in the starting. So whatever you're joining in the starting is the most high yield. Then we go towards the least high yield. That's how the course is designed. So you're already getting the most high yield foundation with the questions and solving done with you, plus our notes and all our resources, plus the math services at the same time. If you're a retaker, this would work perfectly for you. I've had many students with attempts, 2 to 3 attempts, who've been able to pass just by using some of the systems plus going through the mastery itself. Can someone average score 260, 270? I have shown you countless examples of people who felt great. They couldn't believe they had a 285. And the reason they were able to do it is because of the implementation of the systems. If somebody says 899 is a lot, I think if 899 is, I think it's wonderful. If we can save you $92,000 per year that you go unmatched for $899, I think it's a wonderful trade. Like otherwise, I'm not sure how we can help you. And is this legit? You can go and check reviews about us everywhere. We have amazing reviews. We can show you our reviews. And many of the students who match with us can talk about us and to how great we are. And we're just gonna keep getting better as you go through the course. So the choice is now yours. You could either try to do it all yourself, take care of multiple things and take 1 to 2 years to match and then risking failing step 1, dealing with all these updates, or the other path is the USMLE assassin that I can offer you, where I can be on your side, our whole team can be on your side, helping you go all the way from not just crushing step 1, but to step 2 and all the way till the match, right into your dream residency.